And the room gets quiet. Good morning, everyone. Oh, come on. We can do better than that. Good morning, everyone. We have coffee out there. If people need coffee, go get some more, people. We're gonna wake up this morning. All right. Good morning, everyone. It is wonderful to be with all of you today. My name is Rebecca Vallis. I am the incoming CEO of the National Academy of Social Insurance. It is such a total treat to be with all of you today. One of my favorite things is to get to be with interns and young professionals who are just starting out in this work. And so this is one of my favorite traditions that the Academy has had over the years, this Summer Intern Academy, and I'm really excited to be bringing it back for the first time since the pandemic. So thank you for being here. Thank you for taking a little bit of time to be with the Academy today. First, let me just do a little bit of what is the National Academy of Social Insurance. Some of our wonderful Academy interns are in the room, so y'all are all pretty familiar with what the Academy is at this point. Let me do a quick shout out to the Academy interns. Wave a hand if you're one of the Academy interns. Oh, you guys are all sitting at one table. I love it. So we love our amazing Academy intern class, and I think we'll have more folks rolling in to join us throughout the day. But what is the National Academy of Social Insurance? For anyone who's not familiar with it, and maybe this is your introduction to it, first and foremost, the Academy is home to a network of about 1,300 of the nation's leading experts in social insurance. Some of those folks are academics and researchers. Some of those folks are direct service providers, community leaders. Some of those folks are inside government, outside government, shaping policy when it comes to social insurance. And what is social insurance? That's a question that I get pretty much every single day when people wonder, what is it that I do? And then I answer, and then they say, oh, but what is that? So let me do just a quick show of hands. Who is working on social insurance in some way this summer? A lot of hands. Wonderful. Okay. Who isn't but is interested in it, and this is kind of your chance to learn what it is? A couple brave hands. Okay. Who wants to offer a definition of what social insurance is? No hands go up. No one wants to. Okay. All right. Well, I'll do it then. We're talking about the programs and the policies that are there for all of us, that our society has put in place to be there for all of us when we experience what FDR once called the hazards and vicissitudes of life. True story, if I ever get dogs, I'm going to call them hazards and vicissitudes. But instead, my husband and I have cats, and they're all named after wine. That's a whole other story. We're talking about programs like Social Security, Medicare, Medicaid, the Affordable Care Act, Supplemental Security Income, unemployment insurance, the Supplemental Nutrition Assistance Program, SNAP, workers' compensation, all these kinds of programs, right? The things that are there so that when we experience the ups and downs of life, there's something there to protect us from poverty, from hardship, and to give us that adequate foundation to live up to our highest potential. That's what social insurance is, right? Insurance protects us, right? So you're going to be hearing throughout the day from a whole bunch of amazing folks who work on these issues in a variety of different parts of the social insurance ecosystem. And that's a big part of why I get really excited about this particular event. And I want to say, just in terms of what is the Academy, I think of the Academy's members as the stewards of social insurance. I often call the people who are part of that membership network that. And the reason I say that is because the people who are part of the Academy's membership network, and I hope all of you will consider at some point becoming associate members and then members, these are the people who are charged with protecting and strengthening that system of programs and policies that we as a society have put in place to protect us, right? It's really, in my opinion, a sacred responsibility, and I take it very seriously, as do many of the people who are part of our network. So in terms of what we're going to be doing today, it is an incredibly critical time for social insurance. And that might be something that seems really obvious to all of you, because if you've got your eyes open and you're aware of what's going on for us politically, economically, in terms of health, that we're still recovering from the pandemic, on and on, right? This is a critical time for all of the programs and policies that are there to protect us. Unemployment insurance was something that many people newly experienced and accessed during the pandemic, just one example. And for folks who work in the disability sphere, right, the COVID pandemic actually spurred the largest influx of new entrants to the disability community in this country in modern history, right? There's so many ways that social insurance is now more important than ever. But at the same time, this is a really important time for these programs in Washington particularly, because the clock is ticking for policymakers to figure out a way to find common ground to ensure that programs like Social Security and Medicare are actually solvent, right, a technical term, for the long term. So there's so many reasons that the conversations that you're going to be hearing today and that you're going to be part of today are incredibly important, and in some ways, as hokey as it might sound, more important than ever. So I'm really, really excited for you to get the chance to hear from top experts about how some of the most important social insurance programs work, why they matter, how they show up in people's lives. And then we're also going to have a lunchtime exercise where you're going to get down in the in the trenches with actuaries from the Social Security Administration who are going to be coming over today to actually work with you to sit table by table and say, how would we address Social Security's solvency challenge? So this is going to be a day where you're not just hearing, not just asking questions, but you're actually getting into the thick of it with some of the folks who do this every single day. So I'm excited. I hope you're excited. Something like demystifying social insurance might not sound like the most exciting day you'll have ever had, but hopefully at the end of this day, you go, man, social insurance, this is something where I can say I've been bitten by the bug. So with that as just a little bit of what we've got planned for you today, I want to do a huge thank you to the Kaiser Family Foundation for giving us this wonderful space today. We wouldn't be able to do this without their wonderful space. A huge thank you to all of our speakers who are going to be helping us make this day wonderful and interactive and informative and really rich. And then just a little bit of a preview this evening to give you an extra chance for networking. We're going to be hosting a reception on the Academy's rooftop. So that's not going to be in this building. It's actually going to be over at 1441 L Street Northwest, not too far from here, but we have a pretty killer rooftop that we love to throw parties on. So come hang out. We'll have refreshments and a little bit of a chance for you to all get to meet each other and spend some time not sitting around tables, but hanging out and meeting some Academy members too. So with that as a little bit of what we've got planned today and some of why I'm really, really excited for this day, I am really jazzed about our opening panel. So what we're going to do is we're going to ground today's conversations in a little bit of why should we all care about these programs? Why should we all care about these policies? And why should you, as the next generations of leaders, care about the things that we're talking about today? And so I'm going to introduce our fabulous opening panel. Over to my right, we have Courtney Sanders, who is at the Social Security Administration, formerly the Center on Budget and Policy Priorities. And you can take the girl out of CBPP, but you can't take the budget wonk out of the girl. So she'll be talking a little bit about budgets and other things and why she loves that stuff. We have Sabrina Davis from Social Security Works. So excited to have Sabrina with us, and Will Raderman from the Niskanen Center. So Will, thank you for being with us as well. So with that as our fabulous panel, let's just get right into it. And the place I want to start is to give each of you just a little bit of a chance to talk about how each of you came to work on social insurance and the path to the role that you're in right now. I often call myself a recovering public benefits lawyer. That's how I got here. And I'm going to start with you, Sabrina.
Hi, everyone. Good morning. My name's Sabrina. My pronouns are she, her. And I got started in my career in social insurance in a very unique way. I graduated in the pandemic. There were no jobs for 21-year-olds at the time where we had the highest unemployment ever. And I met the executive director of Social Security Works, Alex Lawson, and he was like, hey, do you want a job? And I was like, hell yeah, I do. And I didn't have a single clue about what Social Security was or what it meant for someone like me. And that became rather important because as I learned, I was like, oh my God, this is probably one of the most important issues of my lifetime. And it doesn't get the political attention it does. Social Security is often referred to as the third rail of politics and that no one wants to touch it. But it is something that is completely approachable, understandable, and once we get more people in our generation involved in it, we can make sure that we're getting policies passed for a strong, protected future for Social Security.
Awesome. And Sabrina often refers to herself as the Gen Z voice of Social Security. You can see why, and you're going to love hearing from her some more as this panel continues. Will, do you want to pick it up next? How did you get to where you are now?
Sure. So I'm Will Raderman. I'm at the Niskanen Center, and it's great that you're all here. I think it's going to be a lot of speakers today. But I got my start in social insurance policy being unemployed. As Sabrina mentioned, my start of the career was during the pandemic. Right before that was my first job out of school, which I was working on the Bernie campaign. That ends April of 2020. There's no hiring going on after that. I think I submitted probably 250 job applications over 3 to 4 months. Didn't get any responses except for maybe 2. And didn't get the first one. The second one was a part-time job that was not going to pay well in DC, and I was thinking maybe this was the best I can do right now, and then I didn't get that one either. So it was even kind of the last option that I thought I was going to be able to get was not even there. I ended up getting a job at Boston University probably about a month after that, but I think part of the reason why I was able to get that job was that I had unemployment insurance. I also was living with my parents, so I didn't have rent to worry about, so that was helpful, but I was receiving unemployment insurance. My salary stayed very level, so I was not worried about not being able to cover certain bills. And once again, not having rent was very helpful to that too. But actually applying for unemployment insurance and seeing how bad the online system was, where you need to put in your Social Security number. The website that I was going through looked fake, and I was checking in with family members to make sure I was in the right place because I didn't want to be scammed or anything like that. And it was the right place. It just happened to look like my high school's directory. And you'd want a better looking system for applicants who've never really gone through unemployment before. You'd want it to look more official, and it didn't look anything like that. And so going into that job at BU, being pretty focused on how could we improve UI. That job involved actually tracking some of the state policy decisions during the pandemic, a lot of focus on UI and paid leave changes. It was maybe not the preferred first choice of a job, but I think as we'll probably get into, there's I think you can work towards the job that you most want, and that met 90% of the criteria that I was hoping for, and that was enough, and it really helped in terms of getting to more of the DC-based think tank sort of role. But that was kind of my start to this point.
And Will, you've gone from looking at the unemployment insurance system as an applicant and a recipient to now actually being one of the leading voices on unemployment insurance in Washington. You were just part of the Academy's task force on unemployment insurance and writing and briefing Capitol Hill and doing all these things. So it's I always really appreciate when you bring your personal experience into why you care about these programs. Courtney, how did you get here?
Well, first, I just want to say thank you for inviting me to be a part of this panel, and thank you all for spending a summer day here at the Academy to learn about social insurance. I am a Black woman. I have curly, twisted hair. It is twisted back, and it's out of my face. I am wearing cat-eye rose gold glasses with a blue suit and a brown shirt. So I came at this work a little bit different. I am not going to start at birth, but I will tell you all that, I think what would be the pivotal moment was I was in grad school and I took my first economics course. Anybody take economics course before, right? And they're all in theory and supply and demand. But we start talking about the housing market crash in 2008 and the housing boom. But they never mentioned redlining, which is this law that says we are allowing people legally by the federal government to separate themselves in the communities that they live in just because of the color of your skin. You cannot live next to someone who looks different than you, and it's okay. And so I'm like, oh, this economics, but what about that part? And so I was like, okay, well, this is my first round. I don't know what I'm talking about. Then we start talking about ACA, a social insurance program that mandates employers to provide health insurance for all of their employees who are full-time. But we didn't talk about hiring discrimination for women. If I walked into that interview as a pregnant woman, and then there's a male colleague who also walks into that interview, now that ACA is on the table, who do you think that employer might apply? Pick. And so, I'm like, economists are advising the President of the United States. Economists are the regular New York Times and Washington Post authors that inform our society. And yet, there is a gap missing in this work. So I changed my entire course load in grad school from education policy to economic policy and social policy overnight. I was waitlisted for most of my classes that next semester. But in that moment, I realized that social policy, economic policy is where I needed to be because I had to inform these people who were advising the very thing that drives Social Security, drives social insurance every day. That led me to do some work. I did some work at the University of Michigan's campus, Poverty Solutions, to think about what poverty looks like in respect to dignity and respect, and that led me to the Center on Budget and Policy Priorities, where my colleague, Kathleen Romick, will speak with you all today. We also met there, where I became a policy and tax nerd and budget nerd, and so I'll talk a little bit about that. And now I get to serve at the pleasure of the American people and the President and Vice President of the United States at Social Security Administration. And it has been an honor to do that because we do touch millions of people's lives from the cradle and beyond the grave. And so that's kind of how I got here.
I love you telling that story, Courtney. And you're going to hear, I think, throughout this entire day about programs that in a lot of contexts are talked about as though they are theoretical. In a lot of contexts, they're talked about like a math problem that needs to get solved, especially Social Security, right? But a through line to keep in mind throughout the day and through your work on social insurance, and this panel is grounding us here on this on purpose, is these programs are about people, right? These programs are for people. That's why we put them in place, right? So thank you, Courtney, for starting us there. Sabrina, I'm going to go back to you. Social insurance and especially Social Security often get talked about like they're older adults issues. And yes, Social Security provides really critical retirement security for millions and millions of people. But why should millennials and Gen Z folks care about these issues? And you started to get into this just a little bit in your previous answer.
Thank you for that question, Rebecca. So I'm going to tell a little story about Social Security. One of my good friends, FDR, decided that when you work for your entire life and you cannot work anymore, then you shouldn't retire into the poorhouse, or if you don't have children to take care of you, you don't disappear from society once you're not able to work. So then years go on and we start to expand Social Security to include disability benefits and survivors benefits, because if I'm married and my partner brings in half of our household income and then they pass away from whatever, what the hell am I supposed to do with all these bills and responsibilities? I'm also a proud New Yorker without a driver's license. So if I'm doing my driving school and one of you decides to jaywalk in front of me, sorry, you might get in an accident. And none of us know when we're going to be eligible for any of those types of emergencies, which is why it's insurance. We don't have insurance to get sick. We have insurance in case we get sick. So with that being said, because none of us can determine the future or what's going to happen to our families or spouses or any of our other loved ones, we need to have a program in place to make sure that we can live with dignity even if these things happen to us.
Thank you so much for that, Sabrina. Will, same question to you.
Could you actually repeat the question?
I totally can. Yeah. Will got caught not listening. Just kidding. Question is, a lot of times Social Security and social insurance gets framed as something that's about
Yeah.
older adults, right? And so younger people might be like, well, why am I, that's not about me, or that's not, that's not for me, or why would I care and pay attention to these things? Why should these next generations care about these issues?
Yeah, so, I've talked about my own experience being unemployed. I think with UI specifically, it gets framed a lot of the time as a response to recessions, but you've got 15 plus million unemployment events that happen each year, and so that means you've got a ton of the workforce over even a few years that ends up needing that kind of support, and it's a question of do you have the financial ability to apply and get a job that you actually want versus taking the first offer, which might not be the best role for you. In terms of a connection to unions and labor power, the way I think about it is even at the peak of union strength, that was 30%, 35% of the workforce that was unionized. That's 2/3 of the workforce that did not have the support of a union. So how do you make sure that each individual worker has some kind of ability to make decisions that for themselves that are not just result of getting fired or the employer dictating it because they really are reliant on that salary, and making sure that they can take UI when they're in bad positions and hazardous positions. It's important to have that kind of protection for workers when they might not have any other kind of external support. But so that's kind of how I think about things with UI, where it really does impact workers in a bunch of ways that might not be thought about day to day, week to week. There's other issues. I'm sure there's plenty of other people talking today that'll be discussing disability benefits, but I see it with long-term care. I think a lot of the time when you talk about reaching your senior years, Medicare is going to cover everything. It doesn't. Long-term care is really not covered by Medicare. It's covered by Medicaid. And so you think about all of the life savings that you or your parents or a family member has built up over time. Are you able to hold on to all of it? All of that? Not really. A lot of the time you need to spend all of that down before you can qualify for Medicaid. And so that just doesn't seem very fair. It seems like if you've worked hard your whole life, you should be able to have a fulfilling retirement. And a lot of the time, if you've got any kind of health issue, that means you probably are not going to have what you've worked so hard for. It's not always the bad things that I think social insurance is there for. Childbirth is a very common thing, and it's kind of wild that you need to be worrying about, I could get a bill for $20,000 if my health insurance is not covering everything, or even when it does, it's still a couple $1,000s. And so I think making sure that there are different programs in place, or at least the ones in place are strong enough to make sure that workers, your family, any kind of instance that you might be unemployed, have health issues, have happy things that just you're going to need to go through, making sure those events are covered. And so you just have more time to be focused on yourself and your family.
Thank you for all of that. Well, Sabrina, do you have something you wanted to add?
I think so. Also, as Will was saying, I'd like to expand on, none of us are able to perfectly plan for the future. I can't even plan for tomorrow, in all honesty. So let's say I finally reached the retirement age and I've done every single smart financial decision in my entire life. I'm in perfect health. I have perfect teeth, perfect eyes, perfect ears. My children are fine. I have no financial burdens with them. That sounds like a crock of BS. No one is able to do that, and also no one is able to predict the economic trends of the future. When I was graduating college, I didn't know there would be a global pandemic. I didn't know I'd have to be a nanny. I didn't know that I would have to get on Medicaid. I can't possibly know that. The people who invested all their money with Bernie Madoff thought they were going to have these beautiful, wealthy, secure retirement, and then all their money went down the drain right before they reached that age. So again, as Will said, none of us are able to predict the future, so social insurance being there for us in times of need is absolutely vital.
And you both mentioned disability, but right, just to put a fine point on that one, people often say, oh, will Social Security be there for me? And the answer is yes, and you'll hear about that throughout today. But also, it might need to be there for you tomorrow, right? Because right now, you're covered for disability insurance if you've got any level of work history. And you'll hear more about that in our next panel, but I often try to remind people of that, right? It's not necessarily something that's a distant event. Courtney, I'm going to have you transition a little bit in this next question. You have two things that I'd love to give you a chance to talk about. One is some of how you approach this work, and in particular, the equity lens, the gender lens. There's so many different components of how you're approaching work at Social Security that might not be how people have traditionally thought about or talked about these programs. Some of that is a huge credit to your boss, who is the former commissioner of Social Security and actually is a former board member of the Academy, Kololo Kijikazi. Talk a little bit about how you approach this work and how SSA is approaching this work right now with those lenses.
Yeah, sure. I'm happy to. So, equity is so important. Raise your hand if you know what a distribution curve is, like the bell curve, right? That's like the average. Okay, this is good. I can nerd out a little bit. So equity is important because people, when they're born, the day that they're born, we can actually determine their outcome. From the zip code they live in, to the race and the identity of that child, the day that they're born, because of the average of the outcomes of people that came before them, because of the history of this country and this nation and the public policies that we have, we can actually determine their outcomes. Social insurance creates outliers. It actually reverses some of the poverty that child might experience just because they were born that day, because they can be on SNAP now, because they can be on disability, because that adult who may, on average, could have been in a situation that could be unemployed for years with no income, now can have unemployment insurance just to get back on their feet, to make a difference in their lives, their families' lives, and in the world. And why is that important? Oftentimes, people who are people of color, folks with disabilities, people who are women, people who identify as LGBTQ, find themselves in the average by default. And this is what Social Security is all about. SSI is celebrating its 50th anniversary on sending out monthly payments to people all over this country. 7.5 million people receive SSI. And it is incredible because it's a program that sees people for who they are and try to say, you know what, not today will you die because you're hungry. Not today will you go cold and not have housing, because we're going to give you this monthly payment, not because of the color of your skin, your religion, your gender, or where you lived up and your zip code. We're going to give you this money. In fact, 95% of people who are on SSI are disabled or have a disability. And then that 5% are older Americans that are 65 and up, that are low income. And so I come at this work, and my approach is I think about the people and try to put people behind the numbers that we see every day in our work. And so that's kind of how I approach the work that I do at the agency.
Thank you so much for that, Courtney. So last question for all of you in the last couple minutes that we have. So we're going to do this a little bit as a lightning round. The question is, how can younger folks get involved in this work? And maybe a different way of putting that is, what do you see as the work ahead for the next generations on social insurance? And Will, I'll start with you.
I mean, in terms of the skills that I feel like are the most valuable, I don't think it's even like really complicated academic data skills. It's if you can clean data sets, if you can just put them together for different projects, I think that's kind of the highest value data work, especially if you're looking to get a job in the area. I think when I first realized that this is the kind of work I wanted to do, really just working on my writing. I think being able to convey a lot of important reforms or policies in ways that you can convince people in a pretty succinct way is just, it's very important. And if you can demonstrate that kind of writing ability, it's valuable. I occasionally go back to what I was writing 5 years ago, and I don't really like how it looks. I don't know if I'll ever be the greatest writer in the world, but in terms of practicing and getting as strong as possible at making succinct arguments, I think that is useful in pretty much any job that you could have. So I think those are kinds of like the key skills I would recommend. And then in terms of kind of where to go, I mean, the first couple jobs I had out of school were not think tank policy analysis jobs. It was field organizing in upstate New Hampshire, and then working at a university. And they might not have been exactly what I was looking for, but I think even jobs that you might not think are going to be directly applicable to your ideal kind of trajectory, they end up still being really helpful. I feel like I've gotten a lot more comfortable with public speaking because I was talking to people I didn't really know door to door for 6 months in really cold weather, and that just, I think after a while of doing it over and over, it ends up being helpful, and you get more comfortable with that. But I think that's probably the mindset I'd recommend, is as long as you think it's getting you in the direction of where you want to go. I think that's the most important. And there's, I think, plenty of, especially in DC, but kind of all over, there's plenty of government jobs. There's plenty of think tanks at the federal and local level. There's plenty of advocacy organizations that are focused on issues like Social Security, and it might be one particular policy. Like I really care about a lot of healthcare issues. It's not what I'm directly working on now, but I think if you're able to find a role and get good at that kind of specific area, I think that's all valuable. And I think as long as that's kind of what you can kind of get going for yourself, that's what I would recommend.
Some really helpful practical advice there. Thank you, Will. Same questions to you, Sabrina, and take this anywhere you want to go. It could be career advice, it could be practical advice like Will's offering, and it might be bigger picture. I'm
going to speak as a proud policy nerd, and I think my best piece of advice is to pay attention. Social Security is not a third rail. It is an approachable issue. It is something we can talk about, and it's something we should be talking about. And with that in mind, I want everyone in here to pay attention to the buzzwords and the misinformation that is often spread about Social Security. We're told that people our age are not going to get it. That is simply not true. So long as one person is working in the United States, we will have Social Security. There is a surplus in that trust fund. Additionally, raising the retirement age is a 7% benefit cut per year. I got into a spat with Senator Bill Cassidy because I asked him, why does he want to raise the retirement age to 70 when people like Jeff Bezos and Elon Musk stop paying into Social Security 2 minutes in the year while I pay all year round? And he goes, well, it's not 70. We're raising it to 69 and a half. But then I think of people like my grandfather, who passed away before he reached 69 and had to never retire, essentially. So making sure that we know that raising the retirement age is unacceptable, knowing that we can tax the rich to pay the same amount of all the rest of us, and they can afford it 100%, knowing that we will be getting Social Security so long as we raise revenue, and understanding the legislation that is on the table right now. John Larson has his Social Security 2100 Act to, again, raise revenue by taxing the rich and expand increased benefits through the rest of the century. I think ensuring Social Security until about 2099 is better than 2034, 2035, to me. And, sorry, I had a lot of coffee this morning. So keeping that in mind, knowing that there are solutions on the table and knowing what solutions are absolutely off the table, and making sure that we turn out and speak to our legislators and vote to ensure a secure future for Social Security is one of the most important things we can be doing.
I love all of that. And I love you with your lots of coffee jazz hands, Sabrina. I'll take you like this any day. Courtney, you're going to get the last word. Any advice you want to offer?
Sure. I'll just say 4 things, but I love this energy. And, I will just say, and I'm going to get to your question because I know we're at time and I want to be respectful of time. I have enjoyed connecting with Gen Zers. And I know sometimes I get a bad rap. It's the TikTok dances. It's not you. And I just want you all to know that, this is the energy that drives my work, too. That energy, right? Will and Sabrina are really, y'all are the reason why I'm, elder millennial still talking about Social Security and social insurance, because you all kind of show me the light. 4 things. 1, because you can't take the budget out the girl. There's a quote that goes, "Don't tell me your values, show me your budget, and I'll tell you what your values are." That's what Sabrina's talking about when she's talking about that legislation, right? And the appropriations and all those proposals on the budget and how we really invest in this country now and the future. 3 other things. When you do your best, people notice. When you do your best, people notice. So do your best. Don't worry about, am I faking it? Am I being an imposter? Whatever the case. Do your best and people will notice. Don't try to fake it till you make it. Be you and you will be great. The second thing is, this is my first stint in the federal government. Never done federal government before, technically. You grow where you're planted. If you look at the cement, concrete on the ground, there's still flowers that can sprout through. You grow where you plant it. You might not imagine where you're going to be in the future, but that's okay because you can grow where you're planted. So you're like, oh my God, I'm at an internship that I really didn't want, or it was like my third choice or whatever. He grew where he planted in Boston. Now look at him now, right? You grow where you plant it. And the third thing is thoughts and ideas and words have power and meaning. Someone thought of a chair. Everybody was sitting on the ground back in the day in caves. And then somebody was like, a chair. FDR thought big in the 1930s. And today we get to talk about that. So think big. Thoughts, words matter. Ideas matter. Social insurance matter because somebody thought about it.
Oh, I love all of that. It's real inspiration to end this panel. So please join me in thanking our wonderful panelists, Courtney Sanders, Sabrina Davis, Will Raderman. This is what I needed to start this morning off. I'm loving this energy too. All right, so and I'm going to go ahead and say, knowing all these folks, I think all of them would be totally down for connecting with you guys. So I think what we'll probably do as a wrap up is to send out contact information for our speakers today so that you can reach out to everybody you're hearing from. These are some great folks to connect with. And that is one of my top pieces of advice, is talk to people doing interesting work that gets you excited. That's what I did every single step of my career. Was I would see people who were doing exciting work and I would go, I want to sit down with you. How'd you get where you are, right? Like, tell me your story, right? So do that with all the people that we're putting up on this stage today. So I'm going to let this panel go. Thank you, everyone, for starting us off right. We appreciate you. And I'm going to bring Kathleen Romig up here. All right, so we're going to segue into our next panel conversation, and we're going to have one person who is here in the flesh, Kathleen Romig, who is also from the Social Security Administration, although she's there on detail, so part of her is also at the Center on Budget and Policy Priorities in spirit, which Courtney mentioned. And we're going to have one person on Zoom with us because she is coming back from COVID and wanted to be careful not to expose any of y'all, and so we're really glad to have Darcy joining us on Zoom while we get loaded up. Hi, Kathleen. Thank you for being here. Is your mic on?
Hi.
Wonderful. Do you want to just quickly introduce yourself while Tom is getting Darcy loaded?
Sure. Like Rebecca said, I am now at the Social Security Administration with Courtney. Both of us are advisors to our commissioner, Martin O'Malley. But my very first job was as an intern at the Center on Budget and Policy Priorities, which is where I most recently was. And it was experiences like this that summer that got me really hooked on Social Security. So I'm super excited that you guys are here with us today.
And I am super excited you're here with us. And what we're going to be doing for this next conversation, hopefully you guys all got copies of the agenda, which was on the registration table. So we got a bunch of different topics today. Spoiler, we're not going to talk about every single social insurance program because we don't have time to do all of it in one day, but we are doing a bunch of, it's kind of like maybe the greatest hits. Is this like the greatest hits album? Right. We're doing a bunch of the social insurance programs, and we're starting off with demystifying Social Security and SSI, Supplemental Security Income, which Courtney actually just mentioned because it's having its 50th anniversary. So with that, Kathleen, I think you're kicking us off with Social Security, and then Darcy's going to talk a little bit about the disability programs. And pay really close attention to this, guys, because part of what Kathleen is going to be talking about is actually going to be really important for the lunchtime exercise that you guys are going to be doing. So it's kind of like being told, pay attention, there will be a test, right? It's not a test, but you'll want to hear what Kathleen's going to share. Kathleen, thanks for doing this.
All right. Okay, good. Well, let's get started. So yes, like Rebecca said, I'm going to try to ground you in some of the facts about Social Security so that you can do this exercise, and also just tell you more about why Social Security matters to you specifically. So number one, is anyone getting a paycheck this summer? Show of hands. Okay, well then you are participating in Social Security. You're covered by the program. So that's true of 94% of American workers. They are paying into the Social Security program. The biggest exception, if you're wondering what that 6% is primarily a minority of state and local government workers who are not currently participating. That's a long story. But so out of each paycheck, the line that says FICA, that is Social Security, 6.2% of your wages, and then your employer kicks in another 6.2, up to a limit of 168,000. Well, 168. Well, about 170,000 a year. Let's say that. So it does not include any fringe benefits, but it does include any contributions you're making to retirement accounts. So that's just good for you to know that that's what's happening in your paycheck. Point two is, if I'm going to click this right, there we go. Some of you have probably already received Social Security benefits. If you want to do show of hand, if anyone has received Social Security benefits so far, exactly. So, this is a little known fact about Social Security. A lot of people think it's just for older folks or people with disabilities, but a large number of children also get Social Security benefits. So right now, about 2.5 million children are getting Social Security benefits, and then about another million kids are getting SSI benefits. Like Rebecca said, Darcy's going to tell us a little bit more about that, but those 1 million kids are low income and they have disabilities. So just so you know, 3.5 million kids are getting benefits from Social Security right now. If you go over the course of someone's whole childhood, about 10% of kids end up getting SSA benefits. These are really, I just went too far. These are really important for the kids who get them. Social Security is a big poverty fighting program across the board. We'll talk about that more in a bit, but in particular for children. So only the tax credits, the EITC and the CTC and SNAP, also known as food stamps, bring more kids out of poverty than Social Security. 1.4 million kids for the last year on record were brought out of poverty by Social Security, another 0.3 million by SSI. Okay, reason number 3, you are going to need Social Security, and perhaps you're going to need it sooner than you might think or hope. Close to 1/5 of current Social Security beneficiaries are under the retirement age, and they're getting benefits, basically life insurance or disability insurance benefits from Social Security. Because the truth is, young workers have about a 1 in 3 chance of dying or becoming disabled before they reach the full retirement age. Do you know, is anyone covered by life insurance or disability insurance at your job? Yeah, so some people are, but not everybody is. But most all workers are insured for life insurance and disability insurance through the Social Security program. So that's very valuable. Over 150 million workers are covered. including, as you can see here, a lot of younger workers. And this protection is super valuable. Our actuaries, who you're going to meet in the next panel, have estimated that for a young worker with a spouse and 2 young children, Social Security coverage is equivalent to a life insurance policy that's worth $930,000 and a disability insurance policy that's worth over $600,000. So really valuable. Reason number 4 that Social Security matters is that you are most definitely going to need it when you're older. And that's true whether you think that's true now or not, because life will bring a lot of surprises along the way. And I'm just going to pause right here, and because, you know, as Rebecca said, a lot of people, especially a lot of young people, really do believe Social Security is not going to be there for them. And I want to address that myth. If you take one thing away from today, I want you to understand that Social Security will be there for you. It will look different than it does now, but it is not going anywhere. As I mentioned at the beginning, we're all contributing to Social Security right now through our jobs. As long as that is true, Social Security will keep going. And that's because those current contributions are going right out the door to pay current benefits. So the benefits that my parents and perhaps your grandparents are getting are coming out of those paychecks. In addition to those ongoing tax revenues that are coming into the system, Social Security has what's known as a trust fund, which is sort of, you can think of it in your own personal finances as sort of a rainy day fund. That fund, unlike your rainy day fund, got up to $2.9 trillion. We have another 10 years or so left of that trust fund that will continue to supplement the ongoing tax revenues coming into the program. After that, we do face a reckoning about how to figure out the gap between the money coming into the system and the money going out. But that is a manageable gap, and that's exactly what you guys are going to be solving over the lunch hour. Oh, and another important point here, the gap is about the size of a quarter of promised benefits. So in other words, Social Security has enough funding from current tax revenues to pay 3/4 of benefits for perpetuity. That would be true even if policymakers did absolutely nothing. However, it is silly to assume policymakers would do nothing because, again, we are all participating in this program. Almost all workers are paying in. Almost all workers are going to get a benefit. It's very, very important to people. It's especially important to older voters who are the most reliable voters. So they are going to act, and they're going to make sure that the system is there for us going forward. Okay, back to regularly scheduled programming. Okay, so like I said, almost all older Americans receive or will receive Social Security. So as you can see, this looks like the previous graph about people contributing. In fact, it's a little bit higher than that graph. And that's because maybe a person is not covered by Social Security this year, but maybe they're a teacher, say, in a public school. But next year, they're going to be in a different job where they are covered. Or maybe they're going to marry somebody who is covered and they can get benefits through their spouse. As I said before, Social Security is a dramatic poverty-fighting program. That's even more true for older folks than it is for kids. Without Social Security, about 4 in 10 older Americans would be in poverty. With Social Security, the elderly poverty rate is about 10%. So that's really dramatic. It's really important to people. And one notable thing about these numbers is that the poverty rate among elderly Americans before Social Security was about 40%. And so that, it just shows you how incredibly effective this program has been. Social Security is particularly important for people of color, as Courtney, addressed so eloquently earlier this morning. Same thing is true for women. Women live longer, earn less, and tend to have lower retirement savings. So each dollar of Social Security in somebody's pocket helps to mitigate those differences that exist by race and by gender. And it's also important to bear in mind, we're not talking about lavish benefits here. We're talking about benefits that average under $2,000 a month. I don't know about you, but I am the mother of 2 teenage sons, and I believe I spend $2,000 a month on food alone. So think for a moment about how easy it would be to get by throughout your whole retirement on $2,000 a month, food, housing, and of course, much more substantial medical costs usually. Hopefully you won't have to live on Social Security alone, but it may be more important to your retirement portfolio than you think, and here's why. Who has a pension at their job? It's pretty rare unless you're in the government. So this graph doesn't show federal government. Federal employees do have a pension. Most state and local government workers have pensions. Bear that in mind when you're thinking about your career choices. But in the private sector, it's really rare to have a traditional pension anymore. Instead, workers are being asked to save on their own through vehicles like 401k plans. Sometimes employers contribute to those accounts, and sometimes they don't. But even when workers have the opportunity, and they don't always, to participate in a 401k or 403b or similar, they might not be able to afford to do so. So it's really a DIY retirement system now. It used to be more of a, you have a job and you have a pension that goes with that job. And nowadays, it's much more of a DIY sort of system. How's that working out for us? Not super great, to be honest. For some people, it's working out really well. Some people are saving a lot. Their investments are doing really well. But there's really haves and have-nots, as you can see here. And another piece of unsolicited advice, to the extent that you have the opportunity to save in your workplace retirement savings as you proceed in your careers, you should do so. You should certainly contribute enough to get the full extent of your employer's match if one is available, and you should consider maxing that out. I'm very grateful someone gave me that advice my first week on the job. It has definitely paid off. So a little financial advice there. Not on behalf of the Social Security Administration, but speaking for myself. But you should also understand that even if you do everything right, even if you max out your retirement savings from day one, things can go sideways. You might be depositing money all along and then you get sick or you become unemployed and you need to tap into that. You might be on a good savings path and then your spouse dies or you divorce. You might have accumulated a lot and then there's an economic downturn or some other threat to your retirement, like a global pandemic. So it's really important that you have that foundation that we all have through Social Security. And then 2 more reasons Social Security matters. The next one is, I think, less appreciated than others, but because your parents are getting it, your grandparents are getting it, your siblings are getting it, that means you don't need to support them. This is amazing. Before Social Security, parents typically would move in with their adult children because that was their retirement plan. And with Social Security, that you are able to be more independent and just look out for your own needs and your own family. So that's really important because, like I said, life happens, people run into all kinds of problems, and even if you personally don't run into any problem, could you say the same for every member of your family, your parents, your siblings? I doubt it. And so that's why it's so important. And before Social Security, like I said, people would move in with their children, but not only that, this country had institutions like poorhouses that housed a lot of elderly Americans who didn't have family to rely on. It had orphanages, which is where children would go when a parent would die because we did not yet have Social Security survivors benefits. And so it's a really important thing for people to have access to a benefit like Social Security so that they don't have to, so that institutions like that are a thing of the past. And then last, but certainly not least, Social Security matters to you because your generation is going to be the one that shapes its future. And you're certainly going to be the generation that feels the effects of whatever changes that we make the most. The changes fall into 2 main categories, either paying more into the system or getting less out of the system. And you know what? Who's going to be paying more? Today's workers. Who's going to be getting less? Future beneficiaries. In both cases, that's you. But there are other
it's not, like Rebecca said, it's not simply a math problem, money in, money out. There's a very robust conversation about what Social Security will look like. Should we add benefits back in for college students? Should we add another social insurance component like paid family and medical leave? Or conversely, should we cut benefits across the board? You know, as Sabrina mentioned, by raising the retirement age, should we restrict eligibility? Are there, you know, what will the shape of the system be, not just what's coming in and going out? So like I said, Social Security will absolutely be there for your generation, but it is going to look different. And you have a voice in what it's going to look like. And you can start using your voice today when you do the exercise to try to figure out what you want Social Security to look like going forward. Thank you.
Hi there.
There she is. Hi, Darcy. Thank you for joining us.
Great, thanks for having me. Sorry I couldn't be there in person.
So, Darcy, do you want to start by doing a little bit of just who you are and introducing how you come to this work? And then we're so grateful to hear from you about the disability parts of Social Security.
Absolutely. So my name is Darcy Milburn. I'm the Director of Social Security and Healthcare Policy at the ARC of the U.S. And I've been in this role for just over a year. Before that, I worked on the Hill and in public health academia and human rights advocacy. Really excited to share some background info, like kind of a disability policy and Social Security 101 with you all. So let's see if I can share my screen.
And Darcy, while you're getting that loaded, I think we're going to have our next presentation is going to be around 11:30. So take however much you want, and then hopefully we've got a little bit of time for questions from the room. So
great.
Give you a moment to get your slides loaded. And while Darcy is doing that, I will just say with all gratitude to Kathleen for grounding us in some of the retirement parts of Social Security, the disability parts of Social Security are some of the less appreciated, less well understood parts of social insurance. In fact, when folks do polls that test awareness about Social Security, people by and large are familiar with the fact that it's a retirement program, but part of what we really hope to help all of you have a sense of today with both parts of this presentation is that Social Security is a whole suite of insurance, right? And really important parts of that are the Social Security Disability Insurance Program and Supplemental Security Income, which, as Courtney said, is celebrating 50 years this year. So, Darcy, thank you so much for bringing in this really kind of stepchilded part of Social Security to the demystifying. And your slides are up, so go for it.
Great. All right. So I'll just first start with an intro of what my organization is and why we care about this. So the ARC is the nation's largest and oldest organization that advocates and protects the human rights of people with intellectual and developmental disabilities. Intellectual and developmental disabilities include conditions such as autism, cerebral palsy, Down syndrome, and many, many others. We actively support the full inclusion of people with IDD in the community. And we do both advocacy and direct service provision. We have around 600 state and local chapters. Something that just to keep in mind is that these programs are incredibly important for people with IDD. As many as a third of people on SSI have intellectual or developmental disability, and around half of the children on SSI have an intellectual or a developmental disability. So I hear weekly from various people in our networks and from friends about how these programs both support them and their ability to participate in the community, and also the ways that outdated rules arbitrarily limit the futures that they're trying to build for themselves. So I think the first place to go with this is what is disability, and how does our government define it? So the Americans with Disability Act defines a person with a disability as somebody who has a physical or mental impairment that substantially limits one or more major life activities. And this definition includes people who have a history or record of that impairment, such as cancer that's in remission, or is regarded as having an impairment by others, even if that individual does not actually have the disability, such as a person that may have severe burn scars that doesn't actually limit their major life activity. This is the standard definition legally within the ADA. You'll see in the next slide that the way that the Social Security disability programs define disability is very different. So to meet the Social Security Administration's definition of disability, you must not be able to engage in any, quote, substantial gainful activity. And that means work for pay, essentially, over a certain amount of money. That's you can't work for pay over a certain amount of money because of a specific medically determinable physical or mental disability that is either expected to result in death, or has lasted or is expected to last for a continuous period of time of at least 12 months. So you can see how this definition is very, very limited, and does not include a lot of people with disabilities in our country. Around 1 in 4 people have a disability in our country, and the Social Security disability programs, like eligibility for that, is very, very limited. And so as we go through this presentation, I'd encourage you to think about who is included in these programs and who is excluded. And this is not necessarily the fault of the Social Security Administration. It's because of the way that these programs were designed. Many of them were designed decades ago when the models and how we think about disability was very different. And what society's view of what a disabled person's life could be or should be was very, very different. And in a lot of ways, these programs have not been updated to reflect the realities of disabled people's lives today. As a result, being eligible for these programs is not a good proxy for being disabled, and there's millions of people with disabilities who are not on these programs. And a lot of people may need help that they're not getting because our system isn't designed to provide that help to them. So just overarching basics. As when we talk about Social Security, people generally think about retirement benefits, and there's kind of 2 categories of programs that that the term Social Security can encompass. One category is Social Security old age survivors and disability insurance. Those are known as Title II benefits. And we'll get into what those are specifically. And then the separate program is Supplemental Security Income, or SSI. So people broadly talk about Social Security disability benefits and they may be talking about both SSI and OSDI benefits. Both of these programs provide absolutely critical income support and cash assistance to people with disabilities. So the key differences for SSI, it's funded by our general taxes, and it's a means-tested benefit. That means that you have to meet very, very specific income and medical eligibility criteria. It operates very differently than say our retirement benefits, where if you pay into the system, you can basically it's viewed as your right to have that benefit. For OASDI, it's funded through payroll taxes, and it is that model of social insurance that we're more familiar with. And Social Security and SSI is so important, not just because it provides the cash assistance that people need, but it also gives participants access to healthcare. It's often the key to accessing a lot of healthcare benefits. So for the Social Security benefits like SSDI, which we'll get into, that generally results in access to Medicare. And for SSI benefits, supplemental security income benefits, that generally means access to Medicaid. And this is just a chart explaining what programs look like under that OASDI umbrella, and how that's separate from SSI. We're going to be talking mostly about SSDI and the Disabled Adult Child Program under the OASDI umbrella today. So how do I get Social Security or SSI? To get any kind of Social Security benefit, you have to go through what's called the disability determination process. It's basically an obstacle course, and it can take a very long time. The SSA reviews medical records and information about your income, your resources, your work records, and after you're found to be disabled, then the SSA will also conduct reviews to ensure that you are still disabled. And as a result, just as an example, I've heard from people with Down syndrome who have expressed frustration that they still have to continue to prove that they have Down syndrome in order to receive disability benefits. And then something else just to emphasize is this disability determination process, in making sure that this disability determination process works for people with disabilities is a very important policy issue that we'll get into. I'll start with the SSI bucket that I introduced previously. SSI serves approximately 7.4 million people. The maximum amount of the benefit that people can get is $943 a month, or $1,400 a month for a couple. But due to a lot of different complex rules that we'll touch very briefly on, the average benefit that people get is around $696 a month. That is generally not enough money to raise people above the poverty line alone, and the total cost of that of the benefit to the federal government is $65 billion a year. As I mentioned briefly, SSI has really complex rules and really high barrier to entry. Only around 30% of SSI beneficiaries are approved in their first attempt when they apply, and then overall around 40% eventually end up getting SSI benefits. SSI benefits are also very easy to lose. And that's because under the eligibility criteria, if you have more than $2,000 in total financial resources at any given time, for example, you lose access to your benefits. And that's what's called the SSI asset limit. That asset limit includes cash on hand, money in savings accounts, bank accounts, stocks, bonds, burial policies, and life insurance policies over a certain amount of money. And that's only $3,000 for married couples, which is something we'll also talk a little bit more later on. If you work while you are an SSI beneficiary, the money that you earn actually reduces the amount of money that you receive from your SSI check. And if you receive help from your friends or family to meet rent, for example, that also can reduces your benefit levels. Something else that is really important to emphasize about SSI, and it really reflects the systematic ableism that's inherent in the program design that is antiquated and needs to be updated, is that there are really severe marriage penalties in SSI. If you get married if you're an SSI beneficiary and you get married to another SSI beneficiary, the amount of money that you're allowed to have at any given time and the amount of income you're allowed to have is reduced automatically by 25%. If you lose SSI, you also could lose access to your health insurance because of that link between SSI and Medicaid. So a lot of people with disabilities are essentially not allowed to marry the person they love while maintaining the benefits they need to survive. If a person on SSI marries somebody who's not on SSI, the spouse who's not on SSI's money and assets is counted towards the amount of money and assets that the person on SSI has, and often they lose access to their benefits that way. We'll talk a little bit more about some things that we're doing to try and address this marriage penalty now. Moving on to SSDI. So as we mentioned, SSDI, everyone right now that's getting a paycheck is paying into SSDI. It acts like an insurance policy, and it's supposed to help people if they become disabled, replace income from work. There's currently around 7.9 million SSDI beneficiaries. It's also really difficult to get. Only 33% of applicants ultimately qualify for SSDI. Another policy issue is that the SSDI trust fund is currently solvent, but the overall trust fund might not be able to pay out benefits starting in 2035. Some other things about SSDI that need to change: there's a 5-month waiting period for SSDI benefits once you are determined to be disabled. That's an arbitrary rule that the only reason why it is the way it is because it's expensive to change. Same thing, there's a 24-month waiting period for SSDI beneficiaries before they're able to actually access Medicare. Another distinction between SSDI and SSI is that SSDI does not have asset limits. And SSDI benefits are generally much higher than average SSI benefits. The maximum amount of an SSDI beneficiary can have is a monthly benefit of almost around $4,000 a month. And so it has to do with their employment and work history. But SSDI beneficiaries often struggle to rejoin the workforce because if they are able to, because of very complex work rules and limitations on the amount of income that SSDI beneficiaries can earn while still receiving SSDI benefits. I'll touch very briefly on this subset of SSDI beneficiaries because it's an under-recognized population that of whom people with intellectual and developmental disabilities make up a big portion. There's currently around 1,142,000 disabled adult child beneficiaries. That doesn't mean that these people are children. It means that these people were determined to have a disability that disability began before the age of 22. And they become eligible for essentially SSDI benefits as a result of their parents' work record. And the purpose of this program is to ensure that this disabled adult child can receive benefits if their parent has a disability, retires, or dies. The DAC beneficiaries are also entitled to Medicare after the waiting period. The disabled adult child beneficiaries also have a lot of complex work rules, and they have a very extreme marriage penalty. So just to kind of summarize some of the key things that I've mentioned and advocacy priorities for making these programs work better for people with disabilities. For SSI, we need to raise the asset limits. We need to raise income limits. We need to update outdated rules. We need to end marriage penalties. And we need to improve benefits altogether to ensure that that people on SSI are not trapped in poverty. And then in the SSDI program, there's a lot of really complex work rules and programs that need to change. For the DAC population, work and marriage penalties are things that we need to absolutely address. And for both, access to benefits is a huge issue. The administrative burden of applying to and actually getting the benefits and maintaining the benefits is a huge issue. Work barriers are a huge issue. Overpayments, that means sometimes the SSA may give more money than the person was eligible for at a particular time and then claws back that payment. There's a lot going on currently to try and reform how the SSA deals with overpayments. And then just broad customer service issues is a big concern. People on SSI and SSDI talk about how mentally burdensome it is to keep up with all of the various program rules and requirements to maintain the access to the benefits they need for their survival. And there's a lot that needs to be done to just make these programs, the experience of being a beneficiary on these programs better in general. I'll highlight one bright spot that will be discussed later on today. That's the SSI Savings Penalty Elimination Act. And I think that there will be a congressional staffer who will talk more about this bill. So I won't get that much into it, but it would help raise the asset limits for the first time in around 40 years. And it would help address a marriage penalty. This picture is of our network member named Emily Demko, who is currently impacted by the asset limits. She works 2 jobs, one as an artist and another, actually 3 jobs now that I think of it, and 2 different service jobs, one at Applebee's and another at a local diner. She talked to me about how she isn't allowed to take additional like a friend's shift that they need coverage for at Applebee's because she is worried about going over the asset limit and potentially having her benefits reduced, the SSI benefits. She spoke at the press conference introducing the bill last year. And then I'll just talk briefly about what's going on right now to address marriage equality. This is a picture of a rally last fall, raising awareness about the lack of marriage equality for people with disabilities, where a lot of people who want to get married kind of celebrated their love and on the National Mall with a with a commitment ceremony, performance art protest movement thing. And there's a number of bills that are under current consideration right now that would help address the marriage penalties. There's the SSI Savings Penalty Elimination Act. There's the Marriage Equality for Disabled Adults Act, and there's the SSI Restoration Act. And if you're interested in any and all of this, I would really encourage you to feel free to reach out to me. I can give Rebecca permission to share my email address. And thanks so much for joining me for this super quick tour of some very complex things.
Thank you so much, Darcy. Whew, that was a lot of information. How your head's feeling? Okay, we're packing a lot in today. So one thing I just want to say as we transition a little bit here is some of what you're hearing, right? You're hearing how our programs and our systems are currently constructed, right? And you got to have that baseline to have a sense of what it looks like to work on these issues. But you're also hearing in the context of every presentation today, and this is going to happen throughout the rest of the day, and it's not an accident, what are the things that need to happen to help these programs evolve, right? Because putting in place a policy in 1965 or 1972, right, keeping it static, having it unchanging forever doesn't actually work, right? Our economy changes, people change, society changes, expectations about what life looks like for people with disabilities. All of these things have changed, continue to change, will continue to change. So just to connect back to that opening where I said something super nerdy about being the stewards of social insurance, right? Stewardship doesn't just look like protecting what we have. That's a minimum, right? That's the floor. But it also looks like helping these programs evolve so that they work not just the way that they started 2 years and years and decades ago, but in ways that also meet us where we are and continue to evolve with us. And so that's some of what you're hearing from Darcy. It's some of what you heard from Kathleen. You're going to continue to hear that throughout the day. And a thought experiment that I often will put to people, and so I'll bring it to this group, is what would I put in place to be there for me and my family and my loved ones? Right? Because making policy for other people or about other people results in really bad policy making. That's politics and policy making by otherization, right? So putting ourselves in the shoes of the person who will be protected, is protected by these programs. This is what it looks like to do this work right. And so that's part of what's underpinning a lot of what Darcy's sharing, a lot of what Kathleen was sharing, a lot of what you heard from our opening panel, right? Starting from that place of what would I want for me and my loved ones. And it's probably not being prevented from saving more than $2,000, right? It's probably not being prevented from marrying, right? And all the things. So Darcy, thank you so much for being with us remotely today. Sorry not to have you in person, but I know everyone's going to be looking forward to connecting with you. So thank you for that offer. Kathleen, thank you for being with us today. All right, friends, we're going to go ahead and reconvene. Hope everybody's got some good lunch to fuel us for this next part of the day. So I am super excited about this next part of what we've got planned for you. And part of that is because I'm a huge nerd, but part of that is also because I love the Office of the Chief Actuary at Social Security Administration. I am really, really grateful to Steve Goss and Karen Glenn and this whole set of folks from OACT for joining us. So what I'm going to do just to kick us off is have them go ahead and go down the line and introduce themselves so that they can be humans before we get into all of this, and you can meet the folks behind the curtain who do all that number crunching at Social Security that is so important. And then they're going to give you guys some instructions and some background and some marching orders for what we're going to do as our working lunch activity. And then there's a little surprise for when we get started that Steve brought. So Steve will kick us off, and if you guys want to go down the line.
Thank you very much, Rebecca. No nerds here, just people who care. I'm Steve Goss. I am the Chief Actuary at this point. I've been at Social Security for a while, and we have an amazing crew of people here. Let me pass the baton here to Jason Schultz, our Executive Officer.
Hi, I'm Jason Schultz, the Executive Officer.
Wow, amazing.
Amazing.
All right. Hi, everybody. I'm Karen Glenn. I'm Deputy Chief Actuary for Long Range Estimates.
Hello, I'm Daniel Nickerson. I am also in the Long Range Department under Karen Glenn. a supervisor actuary. The name of my group is called the Long Range Trust Fund Operations Group.
Hello, I'm Chris Chaplin. Also, I had Dan's job before he took it. I've been with the office since 1996. I'll be retiring in a few months, so one of my last public appearance. Capacity prep.
Congratulations, Chris. Hello, I'm Mike Lee, an actuary in Long Range Trust Fund Operations Team.
And Steve, what is an actuary?
Very interesting. So an actuary, I only learned about it in my job interview for this job some years ago. But an actuary is a combination of economists, social scientists, mathematicians generally. It's everything. What do we do? Does anybody here have any auto insurance or apartment insurance or homeowner insurance, health insurance? Guess who does all the analysis of that to determine what the premiums are, what the cost is going to be? Actuaries all over the place. So we're the actuaries for the Social Security Administration for the benefits that you will be getting in the not awfully distant future. I think Kathleen Romig talked about that just a little while ago.
And what does the Office of the Actuary do, Steve? What is OACT?
Oh.
All right, then maybe I'll just let you do your shtick. I just want to make sure that they have a sense of who you guys are before you start saying smart things.
Okay, well, why don't we, yeah. Not broadcasting anywhere, but now we sort of are. So, great. Karen's going to pop. We have a few little slides we just wanted to talk through. I'm just going to give you a little bit of introduction, very much as Rebecca is saying, sort of what we do at Social Security. So Social Security, as you know, started out with the legislation in 1935, first benefits in 1940, and in the law, it's required that the Board of Trustees, Secretaries of Treasury, Labor, HHS, and our Commissioner have to every year report on the actuarial status, which is really the financial condition of the trust funds, of the OSI and DI trust funds. Heard quite a bit around about all already today. And in this includes the actuarial analysis that we do about the near-term and long-term status of the trust funds, whether the revenue that is scheduled to be coming in is going to be sufficient to pay for the benefits that are scheduled to be going out. We do that analysis. It goes into the trustees report every year, starting in 1941, never missed a year, and tells the policymakers, the folks in the Capitol, whether or not we are on a good track or whether they're going to have to make changes, either bring in extra revenue or change things. Now, we do two things there. We do an annual report for the Board of Trustees. We call it the Trustees Report. Big surprise. So that comes out every year. In addition, we also do estimates for the President's budget, the portion that relates to Social Security. And in the process of all of this, by the way, we develop population estimates. We don't have our demographic team here, but that's part of what actuaries are too. We do population estimates for the entire economy of the United States in the future, and all the people who will work and eventually become eligible for and receiving Social Security benefits. All put that together along with all the workers along the way who are going to be paying in taxes like you all are now or will be in the not too distant future, contributing towards the system. And looking at what the balance of that is, that gives us the ability to then tell Congress if we're going to be coming up short at some point, by how much and when, and then give them guidance on the magnitude of what they're going to have to do. The one thing we don't do is tell them, you should do exactly this, that, and the other. We're just sort of like the umpires in the ball game. We score the proposals because, as you know, in the Congress and everywhere, there are different views on how to fix anything. So that's certainly the case. And by the way, a good chunk of what we do, and certainly for the team we have assembled here, are people looking at, evaluating, developing, and scoring potential proposals for making changes in the future for Social Security. So, great. If you flip to the next slide, Karen, just to give you a sense of sort of what we're up against at this point. One of the things we do is we look at the baseline. Where are we expecting to be in the future if there's no change in law? And you can see on this graph, you can see the solid blue line. That's what the cost is projected to be for paying the Social Security benefits as a percentage of our actual payroll. That's all the earnings for all the workers that will be paying into Social Security, all the earnings up to our taxable maximum level, something we'll be getting much more into. And you can see that solid blue line, the cost, is going up from about 2008 to about 2030, pretty strongly, and then staying at a higher level thereafter. But it becomes a dotted line or a dashed line after a while. That's because we're projecting and telling Congress that are not expecting to have enough money coming in to be able to pay the full level of scheduled benefits under law. And you can see how the solid line drops down to be at the red line, which is the amount of revenue we're projecting to be having available. If we were to deplete our trust fund reserves at a point, what happens? We're only able to pay out what is still available in the trust funds, which is equal to what? The continuing income coming in largely from payroll taxes from all the workers. So we're confronted with that. If by 2035, our projected date of having our trust funds depleted, not going away, not exhausted or whatever people like to say, not running out of money, just not having the extra savings account, the reserves on the side, therefore having to just work on benefits with what we still have coming in from annual income, that would be about 83% of what the scheduled benefits are by 2035, dropping down to about 73% of the scheduled benefit level by about 2098. So this is Congress's job to sort of make some changes on that. Now, on the next slide, just really quickly, just a little look at, you might say, well, why is it that we're coming up short? And in particular, we're coming up short compared to what was projected back in 1983. You might have heard about the last big Social Security amendments were in 1983, where the retirement age was increased and lots of other changes. And it put us on a path we were projecting at the time that trust fund reserves would be good until 2063. Now we're saying 2035, big difference. Well, two things are going on. One, we fully anticipated. You can see on the left graph, we call it the age of dependency ratio. The ratio of 65 and older folks to people at working age is 20 to 64. You can see the black line, how this is rising up as the baby boomers move into retirement. And that's not the big problem. The baby boomers moving into retirement, the big problem is that they had lower birth rates in prior generations. So the groups at working age that are following them is relatively low, and that's why this ratio of 65 and over to 2064 is going up so much. And just as a sense of really the magnitude, you can see the blue and red lines tell you that what if the birth rates after 1964 had stayed at about 3 children per woman or about 3.3 children per woman? In the future, you can see this line would not be rising nearly as much, and we wouldn't be looking at the kind of shortfalls we're facing now. That's just to give you a sense of why we have the big increase in cost. But that isn't why we went from 2063 in 1983 amendments back to only 2035 now. That's because one other thing happened. We call it dispersion of earnings. The level of earnings, the amount of increase in earnings for the average, on average, for people in the top 6% of earners, those are basically the people who have earnings above our taxable maximum, that's your $168,600. People have earnings over that. People in that strata had a much, much larger, like a 62% increase in average earnings over and above inflation between 1983 and 2000. The bottom 94% wasn't 62%, it's only 17%. So we had a big shift of earnings going up above our taxable maximum, which isn't subject to tax. So you can see on the right-hand graph, there's a percentage of all of the covered earnings that's actually subject to tax. In 1983, it was about 90%. We were expecting it to stay there, but because of this big shift in the distribution of earnings towards higher earners, more of it going above our tax max, we've lost since 2000 about 8% of what the expected money coming in would be. So we're going to have to, on the next slide, you can see we're going to have to make choices for 2035 to 2098, and maybe make choices and enact things even sooner than that. The choices are going to have to either reduce scheduled benefits from where they are now by on the order of a fourth, or to increase the scheduled revenue, mainly the payroll taxes, 12.4%, up to $168,600 for employees and their employers on a combined basis, and increase the revenue by a third, or reduce the scheduled benefits by a fourth, or some combination. Last, major reforms in the past have tended to be a mix. Big surprise. This is going to be your job today. Rest of our group is going to be talking through a number of the kinds of proposals and provisions that have actually been considered by members of the Congress, which really covers the waterfront. And then Karen will be talking towards the end of our little discussion here about our breaking out and you all making your picks. We can't wait to hear.
Okay, so my part of the presentation is on revenue. Okay, so the first set of provisions involve payroll tax contribution rates. And how that works is, if you're in covered employment, which means you work for somebody who participates in Social Security, then you and your employer each pay 6.2% of your covered earnings. Okay, so and sometimes you'll see the combined rate of 12.4. That's just adding the 6.2 that you pay and the 6.2 that your employer pays. On your tables, you should have a sheet of provisions that you'll consider for the exercise. And these provisions are policy options 2A and 2B on your sheet. So you could refer to that sheet as we go through our presentation. Okay, and then the next possibility for raising revenues is by raising or eliminating what's called the contribution and benefit base. So the contribution and benefit base is it's a cap on the amount of earnings that are taxable for Social Security. It's a programmatic amount, which means it increases by average wages each year. For 2024, it's $168,600. What that means is the most a person can pay in 2024 for Social Security taxes is roughly $10,500. Okay, the exact amount is on the slide. We can move to the next slide. Provisions that involve the wage base or the contribution and benefit base are one is just you could just eliminate it completely, which means just all your earnings would be taxed. Okay, and then because benefits are based on your earnings, there are two possibilities. One is that all of your earnings are considered in the benefit formula. So if you're a really high earner like Bill Gates, you get a really high Social Security benefit, or you would hold the cap for benefits. So there would still be that cap there for the benefit computation. Okay, and on slide 6, Steve had talked about the taxable ratio, and he had mentioned that it was about 90% in 1983, and that the intention what happened is that it declined over time rather than staying stable. And so one of the provisions here is just to raise the contribution and benefit base so that the taxable earnings ratio is 90%. And just to give you an idea of how much that is, it's about $350,000 a year is 90% of taxable earnings. Okay, so I'll turn my presentation over now to who's talking about retirement age? Chris? Great, thank you.
Okay, thanks, Jason. Jason talked about a revenue increase, so I'm going to talk about one form of benefit reduction, dealing with Social Security retirement age. So I think the law is called full retirement age, but it's really called full retirement age or normal retirement age, NRA for short. That's the age at which you claim benefits that the full amount, the full basic Social Security benefit was paid. A lot of acronyms, primary insurance now, PIA. I think I'll stop with the acronyms for now, but that's the basic benefit. So for individuals aged 62 in 2024, I think it's been actually for a while now, the NRA is 67. So what that means is if you can file as early as 62 or as late as age 70. If you file for benefits at 62, you would get 70% of the basic benefit amount, the basic PIA, 30% reduction. If you file as late as 70, you get a 24% increase over that amount, so 124% of the basic benefit amount. And those are permanent increases, modified with annual cost of living adjustments. So moving on to implications of raising the NRA. So if there's no change in a person's behavior at a given age of claiming benefits, the benefit would decrease, but raising to 67 to some higher age. Alternatively, one could delay starting benefits to a certain age to get the same benefit as they would under current law. And the third point here deals with the DI trust fund. So it would increase payments made by the disability trust fund. Why is that? The people who become disabled for benefits before reaching normal retirement age get paid out of the DI trust fund. When they reach normal retirement age, then they would get paid out of the old age survivors and insurance trust fund. So it's sort of a moving around of what trust fund makes benefit payments. And also significantly, if you increase the normal retirement age, there'll be some additional induced applications for disability benefits, which aren't reduced at all. They get the basic benefit amount. Move on to the next slide. Other implications, the workers are living longer, healthier lives. That's one rationale for increasing their retirement age. They can remain longer in the workforce. They'll need to save more time to save for retirement. Their retirement would be longer if life expectancies are higher than they would otherwise. On the other side, difficulties include some workers may not want to remain in the labor force, job availability for older workers, and there are some who may be nearly disabled but not quite meeting our disability standards, who would not be able to get disability benefits. They would be forced to face a benefit reduction. And we have two options dealing with this in 3A and 3B of the handout. I think one raises the core retirement age 68 and one to age 70. So with that, I'll turn it over to, I believe, Dan for discussion of benefit indexing.
Right. So before I get into another type of provision, we'll go a little bit further into the formula for calculating benefits. So Chris mentioned the PIA, the sort of baseline benefit. In order to get to that, we need to first index the earnings that you had through your history. So the amount of a worker's monthly Social Security benefit is based on the worker's lifetime earnings, which are averaged and wage indexed. So you don't just take a straight average because that would sort of exclude the fact that prices tend to change over time, wages tend to go up over time. So each year's earnings are adjusted upward to keep pace with changes to the average wage level. This reflects improvements in productivity and the general standard of living more than just price index increases. So wages tend to go up more than price during the individual's working years. Going to a provision. So one option we can have to another reduction in benefits ultimately, but not for everyone, is to reduce the growth in benefits for higher earners in generations in the future, but to rise by less than the average wage increase provided in current law. Because prices generally rise more slowly than wages, price indexing would result in lower retirement benefits. Benefits for relatively high earners in the future wouldn't be indexed from one generation to the next by something between wage and price increases, and benefits for individuals with lifetime taxable earnings at or above the contribution limit of roughly $170,000 would be indexed to prices alone. So that means every year, with each generation, with each new cohort coming on the rolls, they would have a different calculation of their benefit, where the top earners, the ones at the very top of the contribution limit, would be, from that point on, getting price index at that initial benefit level. So this is sometimes called progressive price indexing. So options 4A and 4B in the handout have two versions of that, where we hold harmless a certain percentile. I think it's 30 and 60 percentiles, the ones we have listed out there. So that means those people below that rough percentile of earnings level would be unaffected, whereas everybody above that would have some reduction, but not until you get to the top level would they be fully price indexed. And I'm, with that, going to pass it on to Karen.
All right. Thanks, Dan. I'm going to talk a little bit about cost of living adjustments for Social Security benefits. So since 1975, benefits have been based on increases in the CPI. And that's really about the prices of goods and services. These cost of living adjustments are effective for December benefits every year, and they become effective in January. This means that benefits will keep pace with inflation as time goes on. So a couple of options to change the current COLA. One would be to use what's called the chain-weighted CPI. And this is based on the idea that consumers, if prices rise in one broad category of goods or services, may shift their consumption to another category, even if they aren't really substitutes. So I know Steve has got a really good example of this. If the price of a car goes up, maybe instead you'll buy a nice big flat screen TV. So not really substitutes, but you're being sensitive to the prices of these categories. One thing to note, that is called higher level redistribution. There is also something called lower level redistribution, which means that you're changing your consumption within categories. So instead of buying chicken, maybe you'll buy fish, something like that. So these are things that really are substitutes for one another. That is already built into the current CPI calculation. So if we were to use this chain-weighted CPI for the COLA computation, by age 85, benefits would be about 6.5% lower. We estimate that this would reduce the annual COLA by about 0.3 percentage point on average. And in your handout, this is policy option 5A. Now on the other side of the coin, there's the CPI for the elderly, or the CPIE. This is instead based on the basket of goods and services for those ages 62 and above, whereas the general CPI is based on all urban consumers. So in this index, certain expenditure groups are given more weight, things like medical care and housing that older folks tend to spend a little more money on. So instead of being lower, as it was for the CPIU, using this index, benefits would be about 4.6 higher by age 85. This would increase the annual COLA about 0.2 percentage point on average. And here you'll see this one in your handout. It's option 5B. I think turning it back to Dan.
Yes, with that last one, we got to the stage where we're talking about the so-called goodies, the sort of small increases in benefits that not uncommon, even though, as everyone knows, there's a overall actual deficit in the program, that people, when they do a full proposal, they might add a few targeted benefit increases for certain populations. The CPIE was one of them, and to introduce the next one, we have the special minimum benefit. So the special min was first enacted in 1972 to provide adequate benefits to long-term low earners. The first full special minimum PIA in 1973 was $170 per month. Beginning in 1979, its values increased with price growth. Again, we talked about that before, which is lower than wages, and is now about $1,067 per month in 2024 for worker with 30 years of coverage. But because of that increasing by prices, and it's only for people with 30 years of coverage, virtually no one is receiving this benefit today because wages have gone up faster than prices. So essentially, the special min benefit is no longer existent, just only a name. So going to the next slide, we have a proposal to increase the special minimum benefit. So in this one, it would, one, increase first as a base the special minimum benefit and then index it to wages. So this option, you set the special minimum benefit to 125% of the poverty level for 2024 at full retirement age for someone who's worked 30 years or more. Poverty level is currently $15,060 for one person in a year. So the new full special minimum PIA would be about $1,569 a month, so almost 50% higher than under current law. And then, as I mentioned, the initial special min PIA level would be wage indexed across generations going forward. So this targets benefits for those lower wage workers. And it should relate to policy option number 6 in your handout. And I think with that, I'm passing off the mic.
Hello? Okay. I'm going to talk about student benefits. So currently, children whose working parents have died or become diseased will receive Social Security benefits until they reach age 19. So in the past, these benefits continued until age 22 if that child was the full-time student enrolled in college. So Congress ended that policy in 1981. The reason I believe they ended in 1981 is because at that time, most baby boomers have gone to college or have finished college in by 1981. So we have a proposal option to reinstate student benefits until age 22 for children of disease or disabled workers if that child is in college. That will make higher education more affordable for young people in families that have lost breadwinner's income. So yeah, the college is more affordable for children raised from poor family. Next slide, please. Next is the option to increase benefits for all beneficiaries. So right now, the average Social Security benefit for all beneficiaries is about $1,870 a month. And we're going to increase monthly Social Security benefits for all beneficiaries by about 5% of the average Social Security benefit. That amount is estimated $94.
Okay. All right, so that last provision was to increase benefits for all beneficiaries. And one thing that shows is that a relatively modest 5% increase for everyone leads to a 22% increase in the overall financing gap. I think that's what it says on the related provision on the page. So another option would be instead to have a more targeted approach, and that would be to increase the monthly benefit amount for all beneficiaries aged 85 and now and in the future by 5%, the average retired worker benefit. So this is sort of doubling down on social insurance in the sense that social insurance is meant to sort of mitigate some of the risk of being old and not able to earn income and running out of your savings or whatever else you have. That's part of what social insurance is for. So this is sort of for those people who have lived even longer than maybe the average person, add an extra little bump. And I'll mention this is often because you guys will all be working on sort of proposals, packages together. This one is sort of sometimes combined with a chain CPI. That's one that sort of compounds over time, where you're getting a small reduction in your benefit relative to current law every year, and it compounds. And so the people who are 85, been on the rolls the longest, they're hit a little bit harder. So this brings back some of that decrease from current law. So specifics for this one is it's 5% of the average retired worker benefit, which is about $96 a month in 2024. It's a uniform increase for these 85-plus folks. So everybody gets the same dollar amount increase regardless of what their own benefit amount is. And again, older age is targeted due to higher risk of inadequate benefit levels. And this is for insurance against longevity. So this is related to policy option number 9 in the handout. So next, we have caregiver credits. So here we would provide Social Security earnings credits for up to 5 years to parents with young children under 6 years of age. So your benefit formula, again, is based on your own income level. So roughly speaking, for retired workers, you would generally take your 35 highest years of earnings. Now, there are many people who take years off to care for a child, and this would be able to help those folks because you might have some gaps in your earnings history due to that. You might not have 35 full years of earnings, or maybe you have 35 years of earnings, but in those years where you're taking care of a child, you maybe worked part-time, sold something on Etsy or something. So this would, the amount of this earnings credit would top up your earnings credit for that year to half the average half the average wage index, which is around $32,000 in 2022. So again, you wouldn't get that full bump necessarily if you had $0 that year, but you would get topped up to that amount as a credit. It's not, you're not being given that money; it's just being credited to as if you earned that amount for the year you had a child care credit. So, and this would replace as many as 5 of the lowest earning years in which the worker has a child under the age of 6. And this is related to policy option number 10 in the handout.
All right. Did you want to say something?
Now, can I just add one little note? A really fundamental and important thing about the benefits of Social Security is, as Karen and Dan well described, is the nature of how benefits change across generations and after you become eligible, let's say at 62 for retirement benefits. As Dan said, across generations, for people reaching 62 this year, then those reaching 62 the next year, benefit levels for people newly becoming eligible tend to go up from generation to generation by the average wage. Why? Because the earnings during their careers tended to increase by average wage from one generation to the next. There's this concept called benefit replacement rate. I mean, how much of your earnings level from your career is replaced by benefits? By having the benefits from generation to generation go up by average wage, you basically set replacement rate for people of similar strata in the economy at about the same. Right now, for the average worker, it's about 40%. Now, what Karen mentioned is really important about the cost of living adjustment. Keep in mind, that's applied only after your initial year of eligibility. So while from one generation to the next, people starting their retirement benefit that keeps up the increasing standard of living faster than inflation from one generation to the next. But after you become eligible for benefits, your benefit level goes up only with the CPI currently. So you're falling behind, very gradually, a little bit behind standard of living of workers from year to year, but at least you're keeping up with prices. It's just that distinction between the replacement rates maintaining from generation to the next, but after you start getting your benefit, then only goes up by CPI.
All right. So we have come to the exercise portion of today's day. All right, putting it all together. So at your tables, you should each have, you have a one-pager that's double-sided that should be enough for every one of you, at least. And then you've also got a slightly bigger packet. There should be 2 of those at each table. That bigger packet has a little bit more detail in case you want to read up on those provisions. So if you don't have all of those, let us know. We've definitely got some extras. But focus on that one-pager. That will go over all of the options we've discussed today during the presentation. And what you are going to do, I know we say here 30 minutes. I don't think we have 30 minutes. We'll give you about...
We do. We've granted you extra time.
Rebecca, thank you.
Moderator's privilege.
Oh, wonderful. All right. So we will give you all at each table about 30 minutes to look at these sheets. Each of the provisions is described, and then next to the provision, you've got the amount of the shortfall it closes or the amount it increases the shortfall by. So review those, decide which provisions you like the best, put them all together into one package. Your goal here is to close the gap completely, or at least narrow it a good bit. So we're asking you to do Congress's job for them, basically. So, and we have faith in you.
Before we get started, we're going to, just a matter of housekeeping, we're going to consolidate a couple of tables so that every table can have the help from one actuary. We've got 6 actuaries here. How often do you get to hang out with 6 actuaries? We are very lucky. And so what I'm going to ask is we have a couple of tables that only have a few people at them. And so I could make decisions for you, or you could self-select and say, hey, we're at a table with just a few people. We'll go hang out at that other table with just a few people. We need 2 tables to do that. So you want me to assign, or you guys want to do it? All right, looks like I'm going to assign. Okay, so this table over here is already getting up, so they've identified themselves. So which table do you guys want to come join? You are. Yep. So how about you come on over here? Come join this wonderful table here. And then we need one other table to do that. How about this table? Yeah? You guys want to come hang out with these folks over here? Perfect. All right. Have fun, everybody. 30 minutes.
We will be joining you at your tables if you need any assistance, but
Commerce, and I think we've also got some of her interns in the house who we were hearing from before over here. John Slattery, the American Federation of Teachers. So what a fun pairing to get to bring the chamber together with labor. I'm excited for this. So here, come sit in the chair I'm in, because I'm actually going to cede the stage to you guys. But we're excited in this next conversation to bring in a whole part of the larger ecosystem here, the larger policy sphere here that doesn't sometimes get included in conversations about social insurance, and that's employee benefits. And so I'm really excited for this conversation, and this is the first time that this has ever been included in the Demystifying Social Insurance Academy. So thank you guys for making some Academy history with us. So with that, I'll give you the chance to both introduce yourselves, and then I know you have a whole shtick planned.
Yeah,
Ladies first.
Yeah, you might want to thank us later. We'll see how this goes. I'm Chantel Shakes with the U.S. Chamber of Commerce. I do retirement policy. I know, sounds exciting, doesn't it? And all things ERISA. You will understand that ERISA is a lot more than what you think. I've pretty much held jobs in the industry and everything other than the government, which is basically saying I can't hold a job. So the whole myth of like, oh, people stay at jobs forever, it's not true. 5 years, that's kind of my max. But before we ask questions about you, I'll turn it over to John.
Yeah, great. Thanks, Chantel. Chantel and I worked together about 12 years ago, I believe, when she used to work for one of her former employers, Buck Consultants.
Many of them.
Yeah, an actuary to our Medicare Part D plan when I was at the Teamsters sponsoring a Medicare Part D plan, and I got to know her, and she helped me with some trustee education programs and being one of my ERISA experts and an expert on Obamacare as well. I don't know if she remembers that. We did a program called The Good, the Bad, and the Ugly, and she did a very good job on that task force. But I've been working in the labor movement almost my entire career. I started as a health insurance underwriter back in 1989 for a union-owned insurance company called Union Labor Life. And from there, I started working as a benefits bargainer at the UFCW, then at the Teamsters for 21 years. I was there a long time.
Exception.
And now I'm with the American Federation of Teachers. And I just am very happy to be here today. I have a little story I might tell as we get going here, but we might do a little point-counterpoint. A lot of you have never, probably didn't watch SNL in the 1970s, but I'm going to let Chantel say...
They weren't born.
I'm going to let Chantel say some things, and then maybe I'll react to them. But I'm happy to be here. I'm very excited for you folks. I moved to D.C. 35 years ago when I was 22, so yes, I am 57. And my wife was 22 at the time as well. But somehow she's only 29 still. I don't know. I'm 57. She's 29. But anyway, Chantel, take it away.
Yeah, got a few questions for the audience first. Who here is still covered by their parents' health care plan?
The majority, I think.
Okay. You can thank ERISA for that. Who here is employed and not an intern? Other than you. So one of the things, so this will be helpful. How many people are seniors? Going to finish your senior year? Okay. We got some people who are going to get jobs next year. It's going to be pretty exciting. Other people, you got another year to go. So John, let's think back. You get your first job. You're all excited, all this great policy work you're going to do. The first thing they do is they bring you into HR. Because everybody loves HR. And if you go into, I have friends in HR, they can be fine, but I kind of have the same reaction. And they give you this huge stack of paper. Or they say, go log on here, and it's as bad as a huge stack because you're like, what is all of this? So, John, what are they going to face their first day of work?
Well, you're going to get hit with a bunch of paperwork or information telling you how to sign up and on board, right, for benefits. And that might be electronic. I mean, I work in the labor movement, so we do it kind of both ways. Yeah, we still do paper. But, most of you are under the age of 26, so you don't have to worry about health care. But I will tell you, there are some folks where it's a better deal to sign up for your employer plan than to be dependent on your parents' plan. But you got to look into that and figure that out for yourself. So the first and most important benefit, though, you got to make sure you have is health insurance, because you never know when you're going to need it. And then there's dental, there's vision, and you might have to pay an extra amount to buy those benefits, which, corporate America kind of came up with these, the Walmartization of benefits. I think they should all be free. But that's another point we can talk about as we move along.
Wages.
Yeah. Well, yeah. I mean, they're pre-tax benefits that you can pay for.
But that's another thing, John.
Yeah.
Does anybody know when we say pre-tax? Okay, a few of you do. So if you remember one thing, because I also, Chad does tax work, and doing benefits, you also have to do tax work. I know, exciting. Keeps me up at night, not really. But the one important thing under the tax code is, under Code Section 61, everything is income unless it's otherwise excluded. And that's what makes it fun, because guess what? Most benefits are going to be excluded. And we'll go back to the history of what that is. But also, if you get your benefits through your employer, they allow you to pay for them pre-tax, which is a big deal. I mean, do you really want to pay tax on stuff? I mean, I don't. I don't think most people are like, yes, me. So they'll let you go through what they call cafeteria plan. It's not where you go and you get food, but the idea is there's all these benefits, and you get to pick which one you want and which one you pay for. Like we said, dental, vision, medical, disability. Do not pay for your disability on a pre-tax basis ever. If you have one thing that you remember from this, pay for it on an after-tax basis.
And then the benefit comes to you
tax-free.
There you go.
If you pay for it on an after-tax basis, when you become disabled and you're not getting as much money, then you have to pay taxes, and that doesn't really make sense. So see, we thought benefits weren't going to be sexy and informative. I mean, guess what? They kind of are. So what's the big one that we work on a lot that we're missing here? Here's with the
401ks.
Yep. Don't forget to sign up for that one. A lot of employers now will have what they call automatic enrollment. And if you don't sign up, they sign you up. So they want you in the plan. Here's something to think about. Even if you can't give a lot of money, whatever you can give, compounding, hell of a drug.
Yeah, exactly. I mean, I was going to say two quick things about that. One, when I came here 35 years ago, one of my wife's friends' dad said, you put $2,000 away per year for the next 30 years, you'll be a millionaire. I'm a millionaire because of my 401k. I've been putting money away. So do the compounding. You guys all know how to do math, right? 1.03 or 1.07 and compound that over 30 years. It's enormous. Do it on your calculator. So yeah, that's one thing you got to keep in mind. But auto enrollment works. I mean, the labor movement, we used to be against that for a lot of different reasons that I won't go into, mainly to do with defined benefit plans that we already had, because we didn't want them supplanted by 401ks, even though that's kind of what happened over the last 30 years. But at UPS, we had auto enrollment, and for full-timers, not part-timers, and the number of people that opted out was like 6 people out of 2,500 people per quarter. It really works, and they have auto escalation as well. So anyway, just to getting off on
this is all the things, and guess what? This is all because of ERISA and the tax code.
Yep.
And that's what we wanted to talk about today, is because, trust me, I did not think about this when I was in college. It was not my top thing. I was a Spanish and Russian major, so for God's sake, God knows I wasn't talking about ERISA. Are you a Spanish major? Yay!
My wife was too.
And then I went to Japan and lived in Japan. JET program, if any of us are interested, it's great. That's an aside. But I fell into ERISA, literally fell into ERISA. I wanted to be a labor attorney on the other side. That's why we're both up here.
I'm not an attorney, by the way.
And then my last internship, I didn't want to go back to Boston because it's cold and I don't like cold weather. And the partner I was working for, his wife was just like, I can have a law student over the winter when I normally don't get interns. And I'm like, I don't have to go to Boston. Win-win. And it was ERISA that I knew nothing about. And that was many, 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 many years ago. And it's been a great career that I could stay with. So this is why we wanted to make this. We're not going to kind of go through the history of ERISA, why we have it, what it did, because it's having a birthday this year. Happy birthday, ERISA.
50 years old, 1974.
1974. And the thing is, it's actually been really evolving, and it needs to evolve more. And we're not going to say that it's perfect. It's never been perfect. But we want to explain what the world was like and why it came about, how it's changed, and kind of we're going to start with, like, where did we get to ERISA? And I'm going to start a long time ago, the late 1800s. What the? If you after this, there's a book that you're interested in. It's called For All These Rights by Jennifer Klein. She's a labor economist. I highly would suggest it. She really goes through the history of both the labor movement, the corporate movement, and why this has all come about, and what we call corporate welfare. Because think about what's happening to the economy in the late 1800s. People were moving off the farms, away from their families, into cities, and working for corporations. We started to get that common law employee, that employee-employer relationship. But guess what? The traditional family was not what you had. You couldn't not just kind of go on the farm and then not work, be taken care of. You had corporations, but they couldn't keep you there forever.
Another good book you should read by Upton Sinclair, I think it's 1906, it's called The Jungle.
The Jungle.
Those people moving from the farms to the big city, and what happened there in the big city, in the meatpacking plants, was pretty abysmal, which helped the labor movement come about. And we're not talking about, that's not directly related to benefits, but that's what the labor movement pushed for soon after that. But, yeah, I mean, the great period of time to talk about. The labor movement, I mean, the conditions working on the job were poor. They improved through labor unions. They improved through the federal government, which you've heard that theme earlier today. But go ahead.
But then part of it was, well, what do you do when you have a worker who no longer really can work? You create a pension. American Express created the first pension in 1880. So this has been going on for a long time. This isn't like a new phenomenon. And it was the idea, what it started is the government was getting in, and we can call them the robber barons because then we start going through there because they were. But corporate America's like, no, we'll take care of this. And then so there's a creation of pensions. And it actually was in the 1913 we got the first income tax. We think of income tax as a given, but it wasn't until 1913. So it's been around for a while, but it didn't really touch very many people. But I think this is where we kind of went off the rails a little bit and made our mistake, and we'll talk about this with retirement policy. These pension plans to be regulated, they didn't go like in the labor code where you think they would or something like that. They were in the tax code. It's all about taxes. Can the corporation get a deduction for it if they put money in? What do you have to do? And so that was really what started what we are going to talk about today, because ERISA is both in the labor code and in the tax code. And unfortunately, what we've done quite a bit is, I do work with Chad actually quite a bit because I do retirement policy and I do tax. A lot of our retirement policy in the United States is driven by the tax code. So it's something to think about, like we were talking about, if you want a better world and a different world, would you have created your retirement policy through the tax code?
Probably not.
Probably not, but that's what we did. And then...
Yeah, before we get too far there, I'm going to go back to the 1800s for a couple of
he likes the 1800s.
Color commentary. The Molly Maguires, the mine workers out west, right? That was a group of Irish mine workers where they started their own union, and you might say was the predecessor to the mob that existed soon thereafter. But what they did, though, is mine workers together, they got together, they paid dues, and when another mine worker would get hurt or die on the job, they would collect all their dues money and give it to their widow or widower. It's mainly a widow and their family, and that was kind of the start of benefits. But they didn't have actuaries or mathematicians saying, well, how many mine workers are going to die this year, right? And how much money are we going to need to help? Are we going to give some people money and other people not? Because if you do it that way, that's called discrimination. So talking about that a little bit, because we're going to start talking about discrimination rules when it comes under the tax code and why that's important both from a benefits perspective and from a union perspective from collectivism. I mean, I deal with labor law attorneys and ERISA attorneys, and I like them both. Depending on, what side of the bed I wake up, which one I want to talk to in that given day. But I deal more with ERISA attorneys. But, talking about the 1800s, I'm going to say one other thing. The first pension plan I'm aware of, because my great-great-grandfather, James Slater, applied for it, was the Civil War pension.
Yeah. The first private.
Yeah, that was the first private. And so he tried to apply for it. He never got it. But if you want to talk to me about what his ailment was to get that, we can talk about that offline. But it seems to be everyone had dysentery when they were in the Civil War, so everyone would apply. But anyway, that's the 1800s. But
now we're going to jump to World War II. We're making progress there. You're like 1800s, World War II. I'm doing all this because, unfortunately, a lot of ERISA was an accident, and a lot of policy, when you start getting into it, it's kind of an accident. And one of the things I say is, whenever you're looking at policy, whenever you're doing anything, follow the money, and you will figure out why it happened. So now let's go forward. Done with the Depression. Yay, everybody's happy. Oh, no, we go to war. Guess what? That's the abridged version of history. If I were drunk, it'd be drunk. Abridged version history would be even better. All of a sudden, there's a wage freeze. So because all the men have gone off to war and wage freeze. So there is a fight for talent. I need people. I can't raise their wages, but what can I do? I can give them benefits. So through a series of private letter rulings, that's where you go to the IRS and you say, hey, IRS, I've been thinking about doing this. Will you let me know, is it blessed or not? IRS comes back and I bless you, you can do it. And so they're like, okay, yeah, this isn't considered wages. So then we get pension plans and we get health care and we get employer provided health care going. And it's not includable as wages. So you can use that as a recruitment tool. And this was one of the things I think both labor and management were supporting because they were so desperate for workers. And then in 1954, so you have the 1954 code, all of that was codified to make sure that employer-provided health care, so all the health care that your mom and dads get and that you get too, technically, that's income, except under Code Section 105, it is excluded from income. And if it weren't excluded, your parents would have to pay for the value of that coverage that you get. So again, healthcare, tax code. So then we're going to jump pretty fast because now we're getting ERISA because now this is getting really excited. You're like, it's already so excited. Now we're going to jump to my fair state where I was born and bred, Indiana, northern Indiana to be exact, Studebaker. Studebaker was based up in Chicago. There was a Studebaker plant where near my house. And does anybody here drive a Studebaker? Anybody here ever heard of a Studebaker? Got a few people. The theater in Chicago is gorgeous. I was just there. They went bankrupt. Like, really went bankrupt. And they had a pension, didn't they, John?
They did.
And what happened to it?
It went insolvent.
And what happened to all the people who maybe were working there 20 years?
They got nothing. And this happened during, I believe, the Kennedy administration.
It was the early 60s.
Yeah. John F. Kennedy started, one of my Democratic heroes, started this drive for ERISA, but it continued on.
Yeah, because it was about 7 years of discussion, and honestly, some corporations, they opposed it. Labor unions opposed it.
We did.
A lot of people opposed it. But the idea behind it was the inherent unfairness, because before, under the tax code, does anybody know what the term vested means? Are you secretly an ERISA attorney back there?
He worked for Mercer.
Oh, you work for Mercer. Okay, never mind. I want great friends at Mercer. If anybody wants to work at Mercer, it's a great place to work. Just Buck is really good, too. I work there.
Buck worked for us, and so did Mercer at the Teamsters.
Everybody worked for them. So vested means the portion of a benefit that you get to keep, that is yours. So under the tax code before ERISA, you were only vested if you retired at retirement age. Like, how messed up is that? And especially for women, because women, their average tenure at jobs was about 4 or 5 years. So they could have been covered by all these pensions, but they never vested. And so Congress started looking into it like, whoa, wait a minute. All these people worked all this time. The pension went insolvent. Nobody gets these benefits. They're just SOL. So what are we going to do about it? It took about 7 to 8 years to pass. Nothing in this town moves quickly, if you haven't noticed. So what did ERISA do?
ERISA was mainly a pension law, right?
Because if you think about it, I mean, back in the day when I went to the family doctor, it was like $5, and 1974, $5 go to the doctor. Insurance wasn't what it was like, and the cost wasn't there. It was mostly pensions.
But it had another effect on healthcare as well. But the pension, what it did is it really made stewards of pension plans fiduciaries, right? And there's a thing called we don't call it the prudent man rule anymore, it's the prudent person rule, that you have to act in the best interest of plan, sole interest. Sorry about that.
I have failed students for that.
Sole interest of plan participants. You can't be acting in any other capacity other than that. And I use that kind of as a hammer at the bargaining table when talking to employers. But there are some certain exceptions, because when you have ERISA plans and you have bargaining units within an ERISA plan, and then you have non-bargaining units, you can do different things.
So the big one was the fiduciary rules, and that was in the labor code. So a lot of this, and we'll give you a little bit of history behind it too, this helps you like how the sausage is made here in Washington, is there was a huge fight, and still to this day there is a fight between the committees. So the committees who have jurisdiction, because I told you, it's in the labor code, so you have the Health Committee and Senate, and the Education and Workforce, or Education and whatever the hell they want to call it, depending on whether Democrats or Republicans are in there, so we're just going to call it Education, and other stuff. They are the labor codes. And then you have the tax code, which is Ways and Means and Finance. And there was a big fight over who wanted jurisdiction, and we ended up with some really horrible parts of ERISA because they wanted to put it in the tax code, couldn't figure out how to put it in the tax code, so they added some stuff to get in the tax code. Then the labor people were like, no, we want it in the labor code. And then what ended up happening, so then they're like, well, we'll put in both. That'll be great. So now you have certain provisions that are in both the labor code and the tax code. Well, that wasn't helpful. We fixed that in 1978. But vesting, we actually mandated vesting. Didn't help women much because it was 10-year vesting, so that's not very helpful. It's much better. We'll talk about that later. It also, funding. They made you fund your plan.
Right.
Which is not a bad idea. You need money to go into it. They made reporting to the government. Tell me how much money is in your plan and what you're doing with it. And another one they did was they have you give notices to your participants, which kind of makes sense. Like, hey, you're in this plan. This is what you're going to get. Now, they've gone a bit overboard, in my opinion, on the notices, but it's another thing. And then they also added, the 1923 code had some non-discrimination rules, but they kind of jacked up these non-discrimination rules. It's probably not what you're going to think. Basically what it says, the non-discrimination rules say, so you can get favorable tax treatment to these qualified trusts, is you can't discriminate in favor of highly compensated employees.
Right. And I'll just two examples that people have used with me over my career the last 30 years here is what used to happen is they would use the example of the doctor, a doctor's office with the nurse and then maybe a secretarial staff, and the doctor who's making tons of money and the rest who aren't making so much money, who's putting most of the money in his account, it was typically a man, and discriminated against those office staffers. And so ERISA helped fix that problem. The other thing, I'll just use the Teamsters for a little bit, the Central States Pension Fund, which I want to thank Sherrod Brown for helping bail it out.
You think me?
Yeah, you're part of that too. They used to have 20-year vesting. So, it took a really long time for someone to get a pension. Driving a truck sounds easy, but it's not. You can't be doing it for 30 years. You're unloading it and whatnot. And so people weren't getting pensions. So over time, ERISA started it, but it was MEPR in 1980 that said it was 10-year vesting for multi-employer plans, and eventually in 1995 it became 5 years of vesting. But that helps with the whole discrimination testing as well. Everybody's getting a benefit. But as Chantel said, it didn't help women all that much because women leave the workforce quite often and come back in and out.
We'll talk about what's happening today with it. Yep. But then, so you get ERISA, 1974, kumbaya, everybody's happy. And then you get this, if anybody wants a job, that you will have a job for life, do ERISA. I'm not kidding you. I have so much security in my life, especially because nobody else at the chamber does it. So then what happens after 1974? The good thing about the law is the good and the bad. It was very skeletal. Does anybody know who Skeletor is? I'm totally aging myself with all this. Skeletor, I love Skeletor. It had no meat on its bones. It needed to be fed sandwiches after sandwich. So you have so many regulations that are coming out. Some good, some bad. Depends on your point of view. And there's this gap. There has been more litigation, more Supreme Court cases on ERISA than any other law. 2 years ago, there were 3 Supreme Court cases on ERISA in 1 year. So it's flexible, but as times have changed, we had to change it. So 1978, kind of by accident, 401k plans were created. They really were created kind of as a supplement to the pensions that covered a lot of people, but nobody got anything from them because of the vesting provisions. But we'll talk about that. They didn't really pick up until the late 80s and early, probably more to the 90s because of technology. What were some other stuff that happened, in the 80s?
Well, going back to the women in benefits, there were a couple of laws passed in the 80s. I can't remember the name of them, but they established qualified domestic relations orders called quadros. Because a lot of time what happens in pension plans, typically in the Teamster world, a man would retire and he'd want his full pension. right? And if he died, you know, he retires at 55 and they weren't very healthy, he died at 65, his wife would get nothing. So there was a thing called joint and survivor that was put in there, so that if you take a pension, by law, you at least have to have a 50% joint and survivor. So if you died, your spouse would get at least 50% of your pension, okay? And then there were other protections built into the 401ks as well. There's a lot. I mean, I dealt with a lot of Teamsters who were men, and they were like, "Hey, what's Quadro?" So I said, she figured that out 2 years ago. But Quadro's when under a 401k, your spouse is due a certain portion of your account balance. Go ahead.
And Quadro's,
I'm not a lawyer, so
Quadro's actually, I have had qualified them before. Something good. Always keep this in the back of your mind if you get married and then get divorced. It doesn't really matter. If you don't get divorced, you don't need a Quadro. But it's to John's point is, if you think about it, marital assets is part of everything's together. But under ERISA, they created a rule called the exclusive benefit rule. That it's yours. Nobody can come after this money. It is held in trust. You go bankrupt, they can't come get it. It's a good thing. Like, this is for your retirement. It is safe. It is sound. Your employer can't get it. Nobody else can get it except your former spouse. Because that, and you negotiate that during your divorce, but because of the exclusive benefit rule, we had to have an exception. So you go and you get a domestic relation order saying whether it's a pension, whether it's 401k, part of dividing up the marital assets. I get this part, you get that part, so you can divide it up. Because before RIA in 1984, you couldn't have that. We also had multi-employer reform, which was really big in 1980. Does anyone know what a multi-employer plan is? Other than you. You don't count. And you don't count either.
Yep.
But you can tell them what it is.
That's my whole career. Taft-Hartley plans are also called multi-employer plans. They've been around since pre-1947 was the Taft-Hartley Act, which made employee benefit plans negotiated with unions when there are multiple employers that participate in them, have a joint board of trustees, of union trustees and management trustees. Prior to that, you had employers putting money into union coffers, and the union was deciding who would get benefits. And that
didn't work well.
That didn't work well. It worked well in a lot of situations, but for the most part, it didn't. But multi-employer plans are great because I like risk pools and I like pooling risks together, risk management. When you put a bunch of employers together in one plan, you get economies of scale, right? You can do more things. The law of large numbers. The more people you have in a plan, an employee benefit plan, be a pension or a health plan, the more predictable the costs are. The more predictable you know when someone's going to pass away, things of that nature. So multi-employer plans developed for a lot of good reasons, a private sector kind of social insurance program, so to speak. And they're still around today. There's about 10 million people that participate in them on the healthcare side and on the pension side.
So then one of the things, we won't get the details of that one, but one thing to start thinking, because remember, we've been mostly talking about pensions.
Right.
But then the 80s start coming along, they're like, oh, snap. You're going to hear a term, welfare plans. It's not what you think. It's not welfare. It's health and welfare plans under ERISA. So that basically just means any employer plan that's not a pension or a retirement plan. So health and welfare would be, obviously, your health plan, your disability plan, dental, vision, life, EAPS, some employee assistance plans, sometimes depending on what it is, severance, all that. So in 1985, they did create COBRA.
Right.
Somebody here has to know about COBRA. There we go. Bad choice. Don't take it. Never take COBRA. It's too damn expensive. Go to an exchange. You'll just
wrong. Sorry, I left my job 2 years ago, and I live in Virginia. And I looked at it. I'm a
crappy exchange.
I'm a healthcare.
DC has a good exchange.
Well, you in DC. I had 2 days to figure it out. But Obamacare is a lot of good things about it, but there are a lot of bad things about it as well. Even with the subsidies, I was going to pay more under Obamacare in Virginia than my $1,789 COBRA, where I got to keep my doctors and everybody that I've been working with for years. So
if you're young and poor, go to the exchange.
Yes,
if you're
exactly.
old like him,
right. But I'm going to tell you, it's you really have to look at it hard.
And you can mess with the system too. But basically, if certain events happen, it lets you continue your group health plan. So one thing that you want to think of mind, look at the exchange, look at COBRA. When you age out from your parents' plan, you can take COBRA. I personally didn't. I went without a coverage for a while. Oops. I didn't say that. So COBRA came along, so they're starting to go into the health direction. You're like, okay.
Do you know what COBRA is? I don't think we really explained it. You know what it is, right? If you leave your job, they have to offer you coverage at the full cost of the plan.
So
no employer
you pay it all,
subsidy.
no subsidy, plus a 2% administrative fee. And how long you get it depends on what the event was. So if you leave your job, it's 18 months. You get divorced from your spouse, you're covered on your spouse plans, it's 36 months. If you're a child who aged out, it's 36 months. If you become disabled, it's actually 29 months, because I loved all this, because when I taught this class, it made it a lot easier for me to come up with questions because the rules were so ridiculously complicated. So it made for a great exam question.
I know you guys are getting closer and closer to present day, but can I just make one suggestion, which is that I think the two of you should really start a podcast together. Because this is some of the most entertaining banter that I've ever heard, just as you're going through history. And also, I think everybody in this room would subscribe to it. So it's just my suggestion.
Oh, trust me, when
She knows all the rules. I'm just giving color commentary.
Well, when I talk about litigation and some of the, litigation in ERISA is so much fun, especially claim for benefits, and you're just like, who did what to whom? My favorite one when I had, this is a story. So anyway, we come to the 90s, and we're going to talk about qualified medical child support orders, which, please, you have that child, you should be paying for it. But apparently, people don't want to do that, so they go out and they have to get a medical order to go to the person who is up their loins and say, we're going to force you on to pay for your child's coverage. I was working for one of my clients, and they got 3 orders for one employee. 3 of the kids were born within 1 month. All 3 kids born in the same month. I don't know when he found time to work. And
wow,
2 of the mothers were probably sisters based on the name, and one looked like a neighbor from a couple blocks away. You cannot make this up. Everybody says ERISA is super boring, but if you do claim for benefits or you go into administration and you see what your employees are doing, you're like, man, oh.
I worked in HR for a little bit, and it's surprising what some of the people that you work not too far away, what they're doing, what they're up to.
But it makes you feel good about yourself. But anyway, we're going to go back to the 90s. So now let's jump to the 90s. It was a great year. The music, I like the 80s better for music, but the 90s were pretty darn good for music too. But we also had
Nirvana.
Hillary. So Hillary Care. She tried, failed. But that started the momentum really in the 1990s. There's an entire new section in ERISA, the 700s, which is all healthcare. Because even though they couldn't get something big, they did get, in my view, I think, some pretty big things. Yep. HIPAA. That was in the 90s, and it had 2 parts to it. Most of us think about HIPAA as the privacy of, we all go into the doctor's office. My favorite time I go in the doctor's office and can you sign this? I was like, I don't need to sign it. I write these. So I was like, I know what it says. And it's probably, you can't understand the damn thing anyway. I wrote it. I know that. So we use
ERISA attorneys do very well, by the way. That's one point I wanted to make. Usually, if you want to go into law, it's boring and it's difficult. But if you become an ERISA attorney, you do pretty well.
Well, we get extra pay. It's called boredom pay. So, all the litigators and all the sexy stuff, SAC attorneys, their base is here, and we get $50,000 more because they're like, my God, nobody could read that stuff and actually make it intelligible. So, and you're always in demand. You get good pay, so that's positive. The positive thing I think really came about HIPAA is the pre-existing conditions. So before HIPAA, you could actually exclude someone from your group health plan based on a pre-existing condition. And if you think about it, that's really kind of crappy. Really? I need health care coverage because I have a pre-existing condition. And so you're going to either exclude me or exclude my condition, which, I don't need any health care. I needed it for that. So HIPAA kind of fixed it. First of all, they made a federal definition of what is a pre-existing condition. So every plan had a definition, including that you actually had to have had the condition diagnosed. Because some plans were like, you'd get covered, and all of a sudden, oh, that was a pre-existing condition. You're like, well, I'm sorry, I didn't know I had cancer. I didn't go to the doctor. Now I found out I have cancer. You tell me it's a pre-existing condition? What? So very positive thing. And then they allowed you to exclude them for a period of time. But if they had past creditable coverage, you would eat away at the time that you could exclude them. And then, your head started spinning.
Oh.
So honestly, I know what our plans.
Well, I mean, they forgot about it. The administration was too difficult. I taught a class at GW at night for the Certified Employee Benefits Specialist group on the group benefits, and I had to go through all this stuff.
Everyone's probably.
I was like, sort of like our current President Biden. I fell asleep while talking on a Monday night at like 9:30. I mean, it was so boring, but I mean, it was very complicated.
Yeah, we're really encouraging them to go into this field. Alrighty then. But don't worry about it.
Practically speaking, the Democrats created these laws that were so difficult for the employers to administer that they just kind of gave up and said, you know what, we're not going to have pre-existing conditions anymore.
And under the ACA, you can't have pre-existing conditions anymore, which is a good thing. So everybody's like, well, it didn't really matter because we got rid of them on our own because it was too much of a pain in the ass. Then there were other things like the New Boards and Mothers Act. That's like, so the drive-by deliveries, you can't really have those, although I did have it. So that means that if you have vaginal birth, you have to be there for 36. You have the choice to be there at the hospital 48 hours. If it's a C-section, 72. I had a friend of mine who was like, I want to get the hell out of the hospital because I can't stand being here. I just want to go home. But you can stay there, and that was what they're saying, that you can't have the drive-by.
My daughters were born in 94 and 96. And so it was like the first pregnancy is very difficult. My wife was home in 23 hours. And the second one, we were ready to go before it was time. But that 48 hours would have been really nice.
Yeah. And so, again, the nice thing about this, and I forgot to say something about ERISA, why it is the most amazing law in the world, is because of preemption. So back in 1974, we forgot to mention that it created preemption, which means it preempts every state law. So like, screw you states, we win. And part of the reason it did it, just think about being in the DMV. I'm an employer. I've got employees in Maryland. I've got them in Virginia. I've got them in the district. And now I have all these different rules on my health plan for eligibility for this. For that. No employer could run a plan doing that. And the good thing about this means that the same rules are going to apply to somebody in the district, that apply to California, that apply to New York, and it actually cuts down on the administrative costs because you're not trying to comply and figure out all these different laws. So preemption is a wonderful, beautiful thing. If I had my world, I would just have every state law preempted no matter what it is, and we just do that because we don't like state law.
And what, I don't want to get into the nitty-gritty on this, but I kind of agree for the most part with Chantel on that. My whole career was like ERISA plans, Taft-Hartley plans that cut across 50 states sometimes. If you had to comply with 50 different state laws and the taxes and the
you couldn't.
Mandated benefits, is too difficult. But there are changes to that coming. I work in the public sector now. They don't like the word ERISA for a lot of different reasons.
Scared of it.
But we can, they are, because they're afraid that states will just get out of providing benefits if they have to comply with ERISA, which is a very odd thing. But that's something that's not that relevant to you today. But ERISA is interesting, but not everybody complies with it, and not everybody likes it.
Well, not everyone has to. So we forgot to say that one thing. This only covers private sector plans. So it does not cover the federal government plan. So I love it. My favorite one all the time is when people are like, well, if you look at TSP, it doesn't cost that much. I was like, well, that's because it's subsidized by taxpayer dollars. And also, they don't have to comply with any of this other stuff that employers have to. States also don't have to comply with ERISA. Churches don't have to comply with ERISA. So everybody tries to be a church plan. Like, yay, I'm a church plan. I was like, you have one priest that's 900 years old, and that's the only person covered by your plan. You are not a church plan. I was like, when I worked there, I kept trying to say the word church plan.
Yeah, a little color commentary. Under the Affordable Care Act, church plans were exempted from the Obamacare rules. And I had to put together a plan, a nationwide plan for the Teamsters, because we had a lot of issues with some coverages being dropped and some people being part-time. And I found a plan that was a church plan that helped me enroll some people in it. And the guy from Tennessee that I spoke to said, we're a Christian church plan. And I said, oh, good. I said, we take all comers. I said, really? Yeah.
But then you're
We take
not a church plan.
Christians, we take Muslims, and then he said, even Jews. I said, well, what about Catholics? He says, well, we're still working on that. But it is bizarre what you can do. But church plans, you could use them to your advantage if you're trying to do something a little interesting.
Puerto Rico's exempt too, so it's fun to work in Puerto Rico. So anyway, now we're to 2003 when a few of you may have been thoughts in your parents' eyes, but may not be around yet. So we have...
Some of them were born by then. We got some people who were born.
A few people in 2003, okay. Now we're getting like, okay, you're alive. You're walking. You're like, I'm going to think about health savings accounts because I'm alive, and it's 2003. And so that's when HSAs were created as part of Medicare Part D. And I bet that's the first thing. What were your first words? Mommy, health savings accounts. Probably not. Well, I know a few of you. It might have been on the retirement side. But then we had Medicare Part D, which was very good.
Yeah, it is very good. I mean, it was prior to Medicare Part D, seniors had to buy their own plans, and there were plans out there, but I think only about half of the seniors had Medicare plans. But now they created exchanges. The concept of exchanges were started with Medicare Part D, and that's what politically, that's what Obama was trying to replicate when he did the ACA, to be honest with you. But Medicare Part D, we ran our own plan at the Teamsters. I was very proud of that.
So then, we'll move past 2003. Now everybody here, they're about 4 or 5 years old. But now we're in 2006. And it's the Pension Protection Act. Some people call it the Pension Destruction Act. Depends on the way you look at it.
It killed single employer corporate pensions.
Yep.
It really did. It put the death knell in those plans because the funding rules were so explicit and so draconian and streamlined and shortened. You used to be able to fund liabilities over 15 to 30 years. I think in corporations they shortened it to 7 years. So employers didn't like pension plans for a lot of different reasons. They're complicated. You got to hire actuaries. You got to hire ERISA attorneys. It's expensive. You don't know what your costs are going to be year to year. Employers do not like fluctuations in costs, especially on benefits costs. So anyway.
And you also have to pay premiums to the Pension Benefit Guaranty Corporation, which can be up to $700 per employee. One of my members pays, it's a company that delivers things to your house quite a bit, and you love them. They are very well funded. They are not going to go bankrupt anytime. Their pensions are very well funded. They pay millions of dollars in premiums to the PBGC as an insurer, and everybody pays the same to the PBGC. Whether you're the shittiest company in the world or you're, like A-rated and best, it's a flat rate premium, and we're going to discuss that later with some legislation maybe.
But there's variable premium too.
And the variable premium. So pension protection, though it did do some good things, so we're not going to just crap all over it.
Right.
It created what we're talking about, automatic enrollment, which is a good thing. How many people in here are lazy? I am. Like, are you really going to do something you don't want to? I mean, is it the most exciting thing? You're like, God, I can't wait to log on and log into my benefits and look at my benefit portal. God, that sounds so exciting. Honey, let's have a date tonight and look at my retirement plan. You're not going to do that. Like, it is ungodly boring. So, but employers are like, they come with this idea, like, well, if we just put everybody in there, first of all, it helps with the non-discrimination rules. Because if I put everybody in there, then there's no non-discrimination because everybody's in it. And it's going to help me down the road because my employees will get money saved for retirement. Because the 401k is a supplement. It is meant, we talked about Social Security. Social Security, hell of an annuity. It's there. 97% of Americans are covered by it, but it needs some help. And that's where your 401k plan comes in. That's where the private sector comes in. We look at these together. They're not a silo because people don't. So employers wanted to automatically enroll people, but because of state law, a lot of state laws, like, for example, you can't just go, your employer can't just like, hey, that's my money. No, you have to pay people. And they were worried about state laws of anti-garnishment. So under the Pension Protection Act, they said, hello, ERISA is going to allow this. Federal law, state law, the hell with you. We don't care. We are going to allow employers to automatically enroll everybody. So that was a pretty positive thing about it. It's the only positive thing I remember about it. Do you remember anything positive about it?
I don't know if I would call this positive, but it allowed, Rebecca was talking about earlier about how things change in Washington, how people's attitudes change. I mean, ARPA, we got a lot of money to help our multi-employer pension plans. $94 billion. In 2006, we thought they were all going underwater and we're going to be insolvent in no time.
2025.
So, yeah, but in 2006, when the Pension Protection Act was passed, it allowed for this thing called, under ERISA, now I can't think about it, accrued benefits can't be cut.
Right.
The anti-cutback rule, they relaxed that because we had a lot of early retirement benefits where you can retire at age 55 or 60, and so it allowed Central States, who was going underwater, to reduce some of those benefits, which gave us more flexibility to keep the plan alive a little bit longer until we got the money.
Pissed off a lot of the retirees, but,
right.
Other than that.
Exactly.
So then, we're going along, we're implementing these rules, 2010, the ACA, the Affordable Care Act. That was probably the biggest piece of legislation on the healthcare side, and it was all health. Thank you, Governor Romney, because it was actually the idea. When it was going through, and this is, I think, it's important in policy when you're looking at these things. So a lot of the stuff in the Affordable Care Act, large employers were already doing. Large employers have never been the problem. The Boeing, UPS, FedEx, they have these benefit plans. They've been there. People expect them to be there. And they can also afford to have, like, in-house people. Like, a lot of these big companies, they have in-house, 2 or 3 in-house attorneys. They have chief investment officers because they have so much money in these plans. And they're only there to invest the money in these plans. And most of the large employers were already doing what was in the ACA.
Correct.
But what it then did was the reporting disclosure. So basically all the ACA did, everyone said that it mandated that employers had to provide health care plans. Not what it did. What it did is said, if you're an employer with 50 or more full-time equivalents, now that's important because they didn't want people to, like, start being like, well, I'm going to make everybody part-time. And if I make everybody part-time, I don't have any full-times. So kind of got around that. If you have more than 50, then you either have to provide health care coverage or pay a penalty. You had a choice. May have been Hobbesian choice, but you had a choice. And actually, a lot of small employers decided not to provide benefits. Like, say I have 51, because it costs them less to pay the penalty than provide the benefits. The larger employers, what the problem was with it was just the reporting and the reporting to the IRS. I had companies who spent hundreds of thousands of dollars to report because you had to get all these different systems talking together. And then my favorite one was I was at home and I got a call from a very large university in Southern California. It's like 7, 8 o'clock my time, and they're freaking out because the IRS software screwed up. And they were assessed a $73 million penalty for not providing coverage. And the president of the university was at a fundraiser, and they immediately contacted him. The IRS wants $73 million from us. They're like, call Chantel. And I was like, it was a mistake. You don't. So that's kind of can make it fun, Friday night, and you have to pay the IRS $73 million for a mistake. But, I mean, it did have a lot of good things. It was aimed at the individual market, although what it did is it covers both ERISA. Well, they kind of did a tricky way. They put it in the health code, in Title 42, but then they said, oh, by the way, they put one little sentence in ERISA to say, yeah, all that stuff in Title 42, that also applies over here. See that. And so finding the law is a pain. 5 minutes. Okay, we're up to 2010. We're going to go. So we're going to go fast. So the ACA, done. It's still there. It's not going away. And by the way, I'm a registered independent because I hate everybody, so I just want people to know. So I'm not going against Democrats or Republicans, but for the love of God, just stop, all right? The ACA has been here. It's been 14 years. Let's just move on.
Even with the new Supreme Court?
Don't go there. I am still a registered independent. So then we are still, I think we have FAQ 587. Department of Labor decided we don't need no stinking regulations. We'll just put out FAQs, frequently asked questions. they would always come out on Friday nights when you're like, and I wondered why I was still single, because that's what I was doing every Friday night, reading these FAQs.
Yeah, 4:59 on Friday night.
And I was always like, who is frequently asking this? Because I'm not, and it just always made me wonder. Anyway, then what's happened since then, there's been a lot of tweaks. So ACA, big deal, still dealing with it. We had Secure, and it's like a Christmas tree. Secure was about retirement plans, mostly defined contribution plans, and it was just a lot of little stuff. Like, for example, long-term part-time employees. You can't keep them out forever, because just let them get in the plan. And it was really no big deal for a lot of my employers, because they're like, fine, I don't care. I don't have to match anything. Just put them in. So it was a lot of little things that everybody had their favorite little thing, and they would throw it in there. I have a PowerPoint on it. If you so desire to have a PowerPoint on Secure and Secure 2, I'm happy to share that with you.
Did they fix the catch-up contributions yet?
No. Then we had ARPA, which was, this is a time when, with COVID coming on, that was 2020, my large employer, single employer plans were going crazy because the lower the interest rate, the higher your contribution to a defined benefit plan.
The liability.
And for your liabilities, think about the airlines. All the legacy airlines still had these old legacy plans. People I didn't even know were calling me. They're like, my God, we have no money. What can we do? So we introduced some smoothing to help get the contributions down. And yes, we did pass the special financial assistance that did not have any dedicated money. It just said, hey, we're going to go help all these multi-employer plans that are heading towards solvency. And if they went solvent, every employer in there would have been. So that is a big reason why we supported it.
Yeah, I mean, it helped employers and helped unions and it helped the plans. But most importantly, it helped participants. And I worked there for 21 years at the Teamsters. We talked about the Central States Pension Plan every freaking day, and I thought it was going under every freaking day. But then out of nowhere comes $36 billion.
I knew where it came from. The
taxpayers, we
the taxpayers. Thank all your parents. 2021, No Surprise Act, Consolidated Appropriation Act. Again, some technical health care stuff. The No Surprises Act is very important because you should not be surprised when you go to an emergency room and they're like, surprise, you're out of network, now you owe $1 million. Because really, like, you have a choice? You don't. You're going to an emergency room for a reason. 2022, Secure 2.0 is the same as Secure 1 because we're not that creative in Washington. And everyone's like, are we going to have a Secure 3.0? And I said, hell no, get a new name. It's all about retirement.
Well, we need to hire you to help us with it, Chantel.
Oh, I've come up with a lot of names, but they have a lot of words in them that they won't allow me to use. And then 2023 Health Insurance Price Transparency Act, which is going to result in tons of litigation. So if you want to become a lawyer and do a lot of litigation, ERISA, you will always have a job, whether you want to do the boring consulting stuff, you want to do policy like I do, you want to do whatever John does.
Yeah, I do a lot of different things. I'm a generalist, but I will tell you we represent nurses, the healthcare sector, and we represent our employees and our bargain plans. I will say under the No Surprise Act and the Health Transparency Act, the hospital systems are winning more than the insurance companies. And that's probably, you guys all think that's great, but it really does create a lot of problems when you go to the doctor. But anyway.
And what it was supposed to solve, I mean, because think about it, it's the only place where you go. Like when I go to the grocery store, I can look and I'm like, oh, well, I could get the name brand and it's $2 more. I can just get, Harris Teeter. Okay, I have a choice. You go to the doctor and you're like, you get the bill after. And it doesn't make sense. Like you can't really compare. You're like, I want to go shopping for something less, but nobody tells you how much it is. And so you're like, well, no wonder our healthcare. I used to focus on healthcare. I focus on retirement now. I used to focus on healthcare. It was fun. It was exciting. I hope you enjoyed ERISA as much as we've enjoyed sharing it with us. There's always internships at the chamber. I think that for the fall, I think that we've done with that. You always have internships?
We have 20 interns a year at the AFT, American Federation of Teachers. Mainly politics, but research and some benefit stuff that you might find interesting.
Please join me in thanking our new favorite dynamic duo, Chantel Sheiks and John Slattery. So I'm going to hold you two to starting this podcast because you're an amazing pair, and I don't think I've ever seen so many people have so much fun listening to history of employee benefits. My proposal for the name for the podcast would be Friends with Benefits.
which could get, complicated for your dating lives. And if you want to do that, we're discussing maybe starting an Academy podcast network inspired by you two. And we would, thanks to Chantel, have it be Drunk Social Insurance History. We'll pay you in wine. So thank you guys so much. Appreciate you. I know they're on that side. All right, so we're going to give you guys a much-needed 5-minute break. This has been a lot today, so take a brain break, take a bio break, and when we come back, we've got one more phenomenal panel for you, and it's Medicare and Medicaid. So don't go away. Lots more to come, but take a quick break, and we'll reconvene. You guys have already learned a ton today. We have jammed a bunch of information into your heads, although I think willingly, because you did come here on purpose. And you've seen a lot of parts of the ecosystem today, right? You've heard from folks who are researchers. You've heard from advocates. You've heard from folks on the Hill, folks who work with folks on the Hill to influence what the Hill does. You've heard from actuaries. Now you've heard from the Chamber of Commerce and labor on the same panel, which doesn't happen very often, actually agreeing on a lot of things, right? So you've heard from a lot of different parts of the social insurance ecosystem today. And now we're gonna move into our final panel, which is health. And a lot of what we've been hearing about today is the income side of things. But we can't have a day about demystifying social insurance without talking about Medicare and Medicaid. And if we had way more time, we would be doing unemployment insurance and workers' comp and other things too. But really wanted to make some space for Medicare and Medicaid as well today. And so to do that, we have two really brilliant, fabulous, amazing experts who are going to break down and demystify Medicare and Medicaid, which you kind of have to talk about together. And so that's why we put them on one panel. And you're going to start to see why we've done that the more that these ladies get into this. But I'm so excited to have with us Natalie Keene from Justice in Aging and Tricia Newman from here, KFF. And the two of them are going to get into it together now. So I suppose this is also your podcast audition, if we're going in that direction.
We're very nervous about that. We just heard about the podcast, and we feel that there's a very high bar that has been set for us. And we are talking about Medicare and Medicaid, which is not generally the most entertaining topic, but we're going to try to make it a little bit entertaining because it's so important. So because I'm at KFF, I also want to welcome all of you here in our building in the Barbara Jordan Conference Center, which is named after the very famous Barbara Jordan, who was on our board and had such an important place in our history, and would be happy to know that there's a next generation coming up to develop expertise and to work in this field. So I'm going to welcome you in from KFF here, a little bit late in your day. I'm going to talk Medicare. Natalie's going to talk Medicaid. These are two different programs, and when I first came to Washington in my first job interview, a member of Congress asked me, did I know the difference? And I was like, I don't know the difference. You will know the difference in about a nanosecond. If anything is not clear, I won't say that Natalie will ask you to interrupt, but I will ask you to just raise your hand if I've said something and it doesn't make sense. Sometimes I talk quickly, and so feel free to just raise your hand and say, I have no idea what you just said. Okay. All right. So demystifying Medicare. Here we go. Why are we talking about Medicare? Not just because it's a social insurance program, and that is what the Academy is focused on, but also it is a very important program to more than 65 million people in our country. That includes more than 55 million people 65 and older, and close to 10 million people who are younger than age 65, who have permanent disabilities, who rarely get attention when people talk about Medicare because people tend to focus on seniors. But they are an important part of the program. We also focus on Medicare because Medicare covers a large segment of the total U.S. population. I talk about Medicare because it is virtually impossible for me to imagine someone aging in our country and having retirement security without Medicare. You've heard today about Social Security, I think, from Steve Goss and others, and other pillars of retirement security. Really, Medicare should be there because nobody can afford health care without good health insurance. Also, Medicare is important because it is a large component of the federal budget. And that is not inconsequential because often in Washington, for those of you who aspire to work in the city, the budget is a big part of national discussions, national policy discussions, and that brings Medicare into the forefront. And not only is it an important part of the national budget, it is a big issue for providers in terms of revenue. So you can see here that Medicare was 21% of total national healthcare expenditures. It accounts for 26% of hospital spending, so hospitals care a lot about Medicare, 26% of physician spending, and a third of retail prescription drugs. Medicare is an engine in our healthcare system. And, you know, it used to be like when Medicare catches a cold, the health system sneezes. There is some truth to that. And it also means when Medicare has advancements, that has spillover benefits for the rest of the healthcare system. Before we get into any sort of the nitty-gritty of the program itself, I want to just step back and remind people that you have a face when you're thinking about Medicare. It could be your grandparents, it could be somebody you know, but the big picture here in terms of demographics, half of all people on Medicare live on an income of $36,000 or less per person. I don't know where you are in your careers or if that sounds like it's a lot or a little, but for most people when they hear that, they are a bit surprised because when you think about the expenses people have, they don't just have health expenses, they have living expenses, transportation, housing. It's not really a lot to fall on, to rely on. Savings, less than about $100,000 per person. What's striking, and I'm not presenting it here, is the disparities in income and savings by race, ethnicity. So these numbers are pulled higher because of higher incomes and assets among people who are white. There's an enormous difference when you look among people who are Black and Hispanic. About a quarter of all people on Medicare have a functional impairment, 20% are in fair poor health, 20% rely on Medicare and Medicaid. That is when we do our duo and we sing a song about people who are in Medicare and Medicaid. 20% about are in rural areas. 17% have a cognitive impairment. I want you to remember that because Medicare has gotten so complicated. And there has been such an emphasis on giving people choice in decision making. Bear in mind that the people who are making these decisions are people who have health problems. Many have health problems. Many have cognitive problems. We did some work about talking to your kids about tough issues, which doesn't sound relevant, except that was all about like talking to your kids about sex and guns and all drugs. So we thought, well, maybe we should do something about talking to your parents about Medicare. Older people apparently don't like to talk to their kids and get their advice on issues. And so the issue is if you're not going to turn to your adult children and you do need help, who will you turn to who can give you neutral advice? That is an issue, and it has become a bigger issue because of the complexity of Medicare. Okay, now really quickly, kind of the boring but important parts of Medicare to just so you're fluent. There is Medicare Part A, and I'll make the slides available to you for anybody who wants a copy of the slides. Part A is mostly inpatient services, inpatient hospital, inpatient skilled nursing facility services. Have you ever heard of the Part A trust fund? People say it's going bankrupt, which it can't do, or trust fund problems. That only refers to the Part A part of the problem. Part B is outpatient services like physician services. It's outpatient hospital services, diagnostic lab services. Every type of service I mentioned has its own payment system, by the way. For Part A, there's a deductible of a little over $1,600. For Part B, there is also deductible, which I'm forgetting, but is about $200, maybe more, and a 20% coinsurance. Part C is totally different. That's the part of the program called Medicare Advantage, which is private insurance plans, HMOs and PPOs, paid by Medicare to provide all Medicare-covered services. I'll come back to that. And Part D is the prescription drug benefit. How's Medicare financed? Well, it kind of depends on which part. Part A is mostly payroll taxes. So it's for those of you who are working and you're paying your 1.45% of payroll tax, that is going to Part A and some other stuff I won't talk about. Part B is a combination of premiums paid by people on Medicare and general revenues, which is taxes. The same for Part D, the prescription drug benefit. Traditional Medicare provides basic benefits that I just talked about, hospital and physician services, but there are significant gaps in coverage which expose people on the program to higher out-of-pocket costs if they don't have other coverage or another means of paying for these things. So, shockingly, I think, traditional Medicare is among the only health programs or plans that does not have an out-of-pocket cap. The ACA really changed that for everybody else, did not change that for Medicare. Doesn't cover hearing aids, eye exams, eyeglasses. Does not cover dental except for limited circumstances. It does not cover long-term services and support that people need, either people with disabilities or older people, as they are no longer able to function independently. And Medicare provides limited premium and cost-sharing assistance to the lower-income people on the program, so that what actually happens, you've heard about the Medicaid expansion, yes, for the ACA. So for people who qualify for Medicaid coverage, they don't need to meet an asset test. They don't have to have a certain level of savings, where people on Medicare do. If they have savings above a certain level, they won't qualify for premium assistance. So there's something called a Medicare cliff, which people have been worried about, where people turn 65 and they may lose the supplemental coverage and assistance they had with Medicaid. So I'm not trying to say Medicare is a lousy program, but what I am trying to say is there are gaps that are concerns for people who are living on limited incomes and don't have a lot of savings. I want to talk about Medicare Advantage because I think you'll hear a lot about it. There's certainly a lot of marketing about Medicare Advantage, and it is changing the fundamental architecture of Medicare. So Medicare for all, those of you, do you remember the Medicare for all discussion that happened in the election, and people were all for Medicare for all? I don't know what you thought, but I thought they were talking about, like, oh, there's a big national health insurance program and everybody's in, Medicare for everybody. The truth is, Medicare today looks very different from that. Medicare, more than half of all people in Medicare are in one of these private Medicare Advantage plans that are operated by companies like United Health and Humana that receive a payment from the federal government to provide Medicare services. So it's important to understand what's going on with Medicare, because if you're of the Medicare for all camp, you have to understand what Medicare actually looks like. And if you're thinking about what the future of Medicare should look like without regard to Medicare for all, you should understand what the Medicare program is looking like. And so this is a lot of words, and I think I'm actually going to skip over all of it. It explains payment issues, too detailed. Come back to it later. You'll have a copy of the slides. Here, what I want to show you is we're now in 2024. More than half of all people are in a Medicare HMO or PPO. By 2028, this is a projection from the Congressional Budget Office, that number shifts to 60%. What you can see is that is a huge difference from what Medicare looked like back when the ACA passed in 2010 and back in 2000. So Medicare is changing, and what's extraordinary about it is it's doing so without a lot of debate. Because in essence, Medicare is evolving into a marketplace program, but nobody's explicitly talking about that and what are the implications for people and for Medicare spending, which I'm going to talk about both of those things. It's just happening. We wrote a paper on 10 reasons why this is happening, and I'm going to go through them quickly. Number one is plans are able to offer extra benefits, and that's in part because they are paid generously by the federal government, by taxpayers. and they're able to offer very appealing benefits, dental, vision, hearing, which people really want. 2 is they're able to do this without charging a supplemental premium. So we've just said how people on Medicare are living on modest incomes. They feel they have no choice but to go into a plan that will save them money on their monthly premiums. There's an out-of-pocket limit. It's simple when you're in Medicare Advantage. It's one-stop shopping. You don't have to sign up for a separate Medigap policy, which is a supplement people in traditional Medicare get, or a Part D plan. You just go into one plan, so it's kind of easy peasy, and everybody's looking to do something easy. There's very aggressive marketing. Brokers get paid more to put people in Medicare Advantage than in other coverage arrangements. Employers and unions are shifting their retirees into Medicare Advantage products. They're doing this in a way to lower their costs for their retiree health liability, but it does have implications for retirees, and some are pushing back, some aren't. Medigap, no guarantee issue for Medigap. So those of you who are ACA devotees will say, like, well, wait, everybody has guarantee issue protections. People with pre-existing conditions can buy health insurance, right? Yeah, except there's an exception for people who want to buy Medigap, which is the kind of insurance that supplements Medicare. They do not have the same guarantee issue protections that other people have. And so people who sign up for Medicare Advantage who want to shift back when they get older and sicker to traditional Medicare may not be able to do that if they have a pre-existing condition. Number 9, high and rising Part D premiums for people who are in traditional Medicare and need to get a drug plan, kind of pushing people into Medicare Advantage. And number 10, beneficiaries are not well informed about the trade-offs. So what are the trade-offs for people in Medicare Advantage? What's the downside? I've just told you about all the goodies: vision, dental, hearing. I didn't even tell you about debit cards and gym memberships and like so many good things the plans are able to offer. Well, the downside is there are also some more hassles. There's more prior authorization requests and denials than in traditional Medicare. Does that really matter for people when they first go in Medicare and they're kind of healthy? No, not so much, because it's just not as big a problem. Is it an issue for people when they get sicker? Yes. Is it a particular issue for people who might need post-acute care, like in a rehab facility, skilled nursing facility where denials tend to be higher? It may. But many people are not aware of this issue and don't think about it until they need it. So that's kind of a number 1 issue. A second trade-off is a narrower network of providers. Again, when you turn 65, you may not care so much about, you may not have a tight connection to a cardiologist and an endocrinologist and all the ologists out there. But as people grow older and sicker and establish relationships with certain specialists, they have to be particularly careful if they're in Medicare Advantage, because if their provider of choice is not in their network, they'll either get charged more or have to pay the full amount if they go out of network. And networks change from year to year. So for people who don't pay attention to what provider is in my network and how do I look at it, they could find themselves in their plan one year and the next year they can't see the same doctor that they've been seeing for many, many years. There is a potential for higher costs. We did a study that says that people in Medicare Advantage plans may pay more on average than people with traditional Medicare who have purchased a supplemental Medigap policy. People don't really realize that because Medigap policies can be like $200 a month. And that's like, why should I pay for that if I can not pay that premium in Medicare Advantage? But they may end up paying higher cost sharing, again, if they get sick and then go into the hospital, where they may, have a $500 copay per day for every day they're in the hospital, and like 20% coinsurance for their Part B drugs, et cetera. And then the guarantee issue point that I won't make, which locks people in. Okay. The other thing about Medicare Advantage is sort of, and this sort of explains why they're able to offer all these benefits, is at one point Medicare Advantage plans were operating a lot more efficiently than traditional Medicare and could offer benefits at a lower cost than traditional Medicare. The Congressional Advisory Panel that looks at payment issues came out this year and said, no, actually things are changing. They're not able to offer the benefits for less. They're offering benefits for more. And because of jumping to that third bullet there, Medicare is actually paying these private insurers 122% or 22% more than they pay for similar people in traditional Medicare. That adds up to something like $80 billion this year in Medicare spending. You might ask, like, well, why do policymakers let that happen? Well, they let it happen because their constituents kind of like the extra benefits, but it raises an equity issue because it means some people on Medicare can get these extra benefits, but 50% of people who are in traditional Medicare can't. And so there's an imbalance of what's considered a guaranteed benefit provided by the social insurance program. And this is a change because one of the sort of basic tenets of Medicare is you get a defined guaranteed benefit no matter what your circumstance is. But now the guarantee has been changed, so that it's one thing for people in Medicare Advantage and it's another for people in traditional Medicare. Okay, I want to talk briefly about the Inflation Reduction Act because it turns out most people don't know about all the provisions that are in the Inflation Reduction Act. So quickly, it requires the federal government to negotiate drug prices for the first time ever, something that was prohibited until now. It dings drug companies if they raise their prices faster than the rate of inflation. It establishes a new out-of-pocket cap on prescription drugs for people on Medicare. I think this is like the biggest sleeper because people don't know about this. And if you are a person on Medicare or you know somebody on Medicare that is sick, I had a family member that spent $13,000, even with the Medicare drug benefit, on her very expensive medication. This provision will cap out-of-pocket spending at $2,000. It's a huge deal that, again, few people know about. I think people know about the cap on insulin, and there are low-income improvements, and eliminates cost sharing for shingles and other vaccines. Where are we? A lot of these things have been implemented already. Next year, soon we'll have the $2,000 out-of-pocket cap. The first negotiated prices that you'll hear about will be announced in September and will take effect in 2026. So this is happening kind of under our watch. CMS is moving rapidly. This slide shows you that while everything is moving forward, some things have been implemented. Most people don't know about it, which is a bit unfortunate because I know the people in the administration think this is a major achievement, but it hasn't really spilled out for the public to hear about it. So what's the current state of play on negotiations? There was a lot of controversy around giving the government authority to negotiate drug prices. But again, everything has moved forward. The drugs have been announced. The negotiations are taking place. The Secretary will announce prices by September 1st. So theoretically, all will move forward except for one little thing in the third box on the right. There are a lot of lawsuits against HHS. The drug industry is not happy about this, and they are raising all sorts of concerns and constitutional issues about what this means. So I guess stay tuned. It looks like this will be implemented, but you never know what the courts will decide and whether or not that can bring everything to a crashing halt. Future outlook, here are some issues to watch, and maybe we could talk about it in Q&A. Implementation of the Inflation Reduction Act, will everything actually go into effect? Benefit improvements, it's actually an interesting question. What should come first? What's the most important way to strengthen Medicare? Medicare Advantage payment policy, how do you set payments fairly, both for plans, Medicare Advantage insurers, but also for hospitals, physicians, and other healthcare providers. That is an ongoing challenge. Leveraging sort of the power of Medicare to improve quality. Medicare has tried to do that in lots of different venues, but there's still work to be done. I don't know if you've been reading a lot about all the nursing home issues. That's partly a Medicare issue and partly a Medicaid issue. Lots more to be done there. financing and solvency with the aging of the population onto Medicare, and finally, the future of traditional Medicare. Will there be a traditional program that people think about when they think about Medicare, or will Medicare be a marketplace of private plans with traditional Medicare playing a far more diminished role if it exists at all? So with that, easy, quick demystifying of Medicare. I'm turning it over to Medicaid, which is actually a lot more complicated.
Yeah, thanks, Tricia. When I started working at Justice and Aging, I was under the impression that Medicare was simple, but actually it's not as simple as we think, but I agree that Medicaid is a bit more complicated. Just a bit about Justice and Aging. We're a national nonprofit organization that uses the power of law to fight senior poverty. We work to secure access to affordable health care, economic security, and the courts for low-income older adults. We are committed to advancing equity across our issue areas, including addressing the enduring harms and inequities caused by systemic racism and other forms of discrimination that uniquely impact low-income older adults and marginalized communities. And that includes a commitment to recruiting, supporting, and retaining a diverse staff and board. All right, so Medicare basics. First thing, Medicaid is not Medicare, and I just misspoke. I said Medicare basics. Yeah. So please forgive us, right? Yeah, exactly. But they were enacted in the same year, 1965. Medicaid is Title 19 of the Social Security Act, and from the beginning, Medicaid has been targeted to low-income individuals. So their eligibility for the program does depend on financial need. Medicaid is also an entitlement. So generally, there are no enrollment caps. A big exception for home and community-based services, which I'll talk about later. But basically, if you meet the eligibility requirements, you get coverage. So Medicaid programs vary a lot from state to state. States actually have the choice of participating in Medicaid, but all states have done so since the 1980s. But if they participate and get federal funding, they have to comply with certain basic federal laws and requirements for the program. But even within that, there's still a lot of flexibility, and this is where Medicaid gets extremely complicated. So states can set their own eligibility criteria. They can design benefit packages. They can waive some federal laws and rules. They have to get permission from the Centers for Medicare and Medicaid Services to do that, but many do have these waivers. And they can also contract with private insurance companies to provide services through managed care. So as Tricia was talking about with Medicare Advantage, managed care is also on a steep rise in Medicaid as well. And the result is really a lot of complexity within states and across states. States might call their Medicaid programs by different names. In California, it's Medi-Cal. I think Wisconsin is something like Badger Care. So that adds to the complexity of sometimes people don't know that they're on Medicaid when in fact they are, which I think goes to Eileen's point about we really need to be talking about the program and making sure that people understand how important it is. A little bit about Medicaid's evolution, and this is a wonderful slide from KFF's primer on Medicaid, which I have a link to later in my slides. So Medicaid, when it began, was historically tied to eligibility for cash assistance, either the aid to families with dependent children or supplemental security income. But over time,
There have been increases in access options given to states to cover more populations, and particularly for children, pregnant women, and people with disabilities. The Children's Health Insurance Program, or CHIP, was a big expansion, and that happened in the 90s. And then, of course, the ACA Medicaid expansion. At the end of the slide, you'll see 2020, when the COVID-19 pandemic hit, there's a big rise in enrollment because Congress said that the federal government would give states additional funding for their Medicaid programs, but on the condition that the states did not disenroll anyone from the program. And so states were prohibited for a couple years from doing redeterminations for eligibility or kicking anyone off of the program. Now that process has begun. It's sometimes referred to as Medicaid unwinding, and we are seeing a big drop in coverage. And unfortunately, a lot of people are losing coverage, not necessarily because they're ineligible, but because they didn't receive or understand a notice that they needed to do something to renew their coverage. So who does Medicaid cover? And I think this is why, why people like the program. And as Eileen was talking about during the fight to repeal the ACA and cut Medicaid, you know, we really realize how many people are connected to the program. I think there was a stat that pretty much everyone in the U.S. either knows someone who had Medicaid or has Medicaid. It covers about 80 million individuals currently, so more than Medicare. About 1 in 5 people nationwide, and that ranges by state, from about 10 or 11% in some states to as much as 34% of the population in other states. As I mentioned, there was a sharp increase in enrollment during the pandemic that is now falling. Some specific groups, it covers 39% of children in the U.S., 41% of all births in the U.S., 43% of people with disabilities, 7.2 million older adults ages 65 and older, 1 in 5 Medicare beneficiaries who also have Medicaid, and 6 in 10 nursing home residents. So a little bit more about why it's about the complexities and the federal requirements and the state options. So states are required to cover certain groups under their Medicaid programs. That includes children, people who are pregnant, certain parents or caretakers, people with disabilities, older adults, and the Medicare buy-in groups, the Medicaid paying for Medicare premiums, as Tricia was mentioning. And then states also have the option to cover several other groups, including the Medicaid expansion under the ACA. So when that was originally passed, all states were going to be required to expand Medicaid. That went to the Supreme Court. Now states have the option, but we're currently at 41 states who have taken that option. They can also cover what's referred to as medically needy. These are people with high medical costs who can spend down their income to become eligible for Medicaid on a monthly basis. 44 states provide that option. People who have disabilities and are working can buy into the program. 48 states have those type of programs. There's also a program called Katie Beckett, which allows children with significant disabilities to stay at home, and eligibility for that looks only at the child's income. So it really opens up the access to home-based services for a lot of children. So a spotlight on dual eligibility. This is where it gets even more complicated. Medicare and Medicaid trying to work together, and they sometimes do okay, but not always. But both programs are really important to low-income older adults and people with disabilities. So an individual can be dually enrolled in Medicare and Medicaid if they have Medicare based on age or on the basis of disability. And then there are two types of ways Medicaid can be helping someone with Medicare. The first way is we call full dual eligibility. These are individuals who are eligible for full Medicaid benefits that would wrap around their Medicare benefits. So this is really important because Tricia mentioned the gaps in Medicare coverage for things like dental, vision, hearing, long-term services and support. Medicaid is really crucial for a lot of people to provide coverage of those services. There are about 9 million people who are fully eligible for both Medicare and Medicaid. And then we have partial dual eligibility, and these are individuals who are eligible for a Medicare savings program only. This means that Medicaid is paying for their Medicare premiums and sometimes their cost sharing, but not providing any actual services. And there are about 3.4 million individuals in this category. Common characteristics of people who are dually eligible. So everyone who is dually eligible has low income, modest savings, and limited resources. 87% had an income of $20,000 or less in 2020. So, looking at, again, the slides that Tricia shared, about the Medicare population overall having, quite low income, but people who are dually eligible are really in that lowest quartile. Some people at one time may have had more savings and income, but have had to spend that down or divest in order to become eligible for long-term services and support. And then sometimes people with disabilities who face discrimination and other barriers in working are also dually eligible and reliant on both Medicare and Medicaid. Most people who are dually eligible have higher health care needs. 63% have 3 or more chronic conditions. And it's a more racially and ethnically diverse population than the general Medicare population. So almost half of Medicare, Medicaid dual enrollees are people of color. Okay, back to what Medicaid covers. So again, there's a list of things that the federal government requires states to provide. And this is not completely exhaustive, but some major examples of services are physician services, hospital services, nursing facility services, labs and x-rays, home health, transportation to medical services. So this includes non-emergency transportation, which is really critical, again, for this population and something that Medicare does not provide. Medication-assisted treatment for SUD, the EPSDT program for children, family planning services. Now, what I think is more interesting is the list of optional benefits and kind of surprising what is not required, but things like prescription drugs. All states do cover prescription drugs, but again, it's an optional benefit for states. Physical, occupational, and speech therapy, dental, vision, prosthetics, home and community-based services, which again, I'll talk more about later. All right, so Medicaid plays a really important role in covering long-term services and supports. And this slide from the Congressional Research Service kind of helps illustrate what we're talking about. So on the left, you have acute care, and then post-acute care, and then on the right, long-term care. And these include things like personal care to help people with what are referred to as activities of daily living. So eating, dressing, bathing, toileting. They can also provide things like homemaker and chore services, employment support, even sometimes legal aid supports, transportation, even outside of the medical care context. So a lot of things, like one reason we call it long-term services and supports is to recognize that a lot of the services that Medicaid covers are not medical in nature or health, directly health related, but they're a lot of social services. And they can be provided, long-term services and supports can be provided in an institutional setting like a nursing home or in a home and community-based setting. So Medicaid is the primary payer of long-term services and supports in this country, including for both nursing facility and HCBS. We know that most people who need these services want to remain living at home in their community rather than going to a nursing home. But from those previous lists, we know that federal law does not require states to provide these services in the home and community. They do require states to provide nursing facility services. So there's a bias in the federal law. We call it the institutional bias. But this can really lead to a lot of gaps and inequities in coverage. So this home and community-based services is one place where Medicaid programs can cap enrollment. This leads to waiting lists and unnecessary institutionalization. People who cannot wait years on these lists to get services end up having to go to nursing homes to get their needs met. We see a lot of inequities by population, more older adults in nursing facilities across and even within states. States are sometimes distributing their slots in these HCBS programs inequitably so that people of color have less access to these programs, and then that's an example, too, of how it leads to race-based inequities. Financial eligibility is another very complicated thing, and I'm glad Tricia already touched on this a little bit, but there are basically two ways now since the ACA that financial eligibility can be determined for Medicaid. One is MAGI, Modified Adjusted Gross Income. There's no asset limit. This applies to children, pregnant individuals, parents, non-disabled adults through the Medicaid expansion. Non-MAGI tests both income and assets. And this applies to people age 65 and older, people with disabilities, people who have a share of cost. And on the right side, another wonderful KFF graphic that illustrates just the income eligibility for these different categories. And again, because I work on behalf of older adults, just a little more detail on how complicated it is for aged and disabled eligibility. This has historically been tied to SSI, which, as I'm sure you learned earlier today, have very, very low limits. Most people who are eligible for SSI are automatically eligible for Medicaid. And then states can set higher income limits and asset limits. More states have chosen to increase the income limit for this population. than states who have chosen to increase the asset limit. But we're seeing some positive movements. California, for example, completely eliminated their asset test for this population. And there's also different rules for long-term services and supports often in states. So again, they're very, very complicated. And we often say, if you know one Medicaid program, you know one Medicaid program. And there's the resources.
Amazing. Thank you so much. There was so much information in that presentation. So I think we have a couple of minutes for questions, which we have not had for all of our panels yet because we've been doing a lot today. But does anyone have any questions for Natalie or Tricia before we wrap up? Oh, we got questions. Look at this. All right. Over here, right closest to me, say your name and also where you're interning this summer. And I'm going to bring a roving mic around.
Thank you. Hi there. My name is Allison Tate. I'm interning at the Center on Budget and Policy Priorities. I had one question on Medicaid and one on Medicare. The one on Medicare. Medicare would be, how do you mentioned the Inflation Reduction Act. I'm curious how the government is setting that price for drugs. If it's not based on market, we've learned a bit in econ class about how I think if you do continue the private market price, then the providers will just keep setting it higher. So what is the price that they choose? How is it capped fairly? And then question on Medicaid.
I might want to take the Medicaid question instead.
You would?
Not taking the Medicare.
Curious about it. Because, prescription drugs, we all know they're really expensive. I was curious about the non-emergency transport. Like, is there a waiting time for that that's unrealistic, or how does that tie in? It's not an ambulance. I don't know how that system works, but would love to hear more.
Okay, I'll get my answer over with because it's such a hard question. And really, we don't know the answer. So in the law, there are certain constraints on what the price can be. But the Secretary is directed to take into account a lot of different factors in determining what the Secretary's offer will be. So, for example, research and development costs, whether or not there are similar drugs out there, what are the benefits of the drug? So there's like a laundry list of things that need to be taken into account. There is this sort of back and forth between the Secretary and the drug company that has been occurring, that's going to wrap up in August, when a price will be announced. The challenge is knowing whether it's a good price or not, because we don't really, there's such a lack of clarity about drug pricing that it will be, I think, very difficult to know, did the Secretary land a good price, cut a good bargain? I think the drug industry will say, this is horrible. Whoa, I can't believe how much what they've taken out of us. But, consumer advocates might, turn around and say, this is still super expensive. And I think it'll be very hard for mere mortals to be able to assess exactly, how effective the price has been, the negotiations have been. So that's a long-winded way of saying there are a lot of factors that should be taken into account in this back and forth, but what actually happened during this process is not known. And, what factor weighs heavily more than others is not clear. So I think we're going to do a little bit of wait and see on that one.
And on the non-emergency medical transportation, so Medicaid does have like timeliness requirements and so on, but it's a challenge on the ground. It doesn't work as ideally as we would hope. States are trying different things. It can be a challenge to get reliable providers. I think some states have tried partnerships with rideshare companies and different ways to help get better access. But we do hear stories of people not having their ride show up or leave if they aren't out the door, right on time, or, having to get a ride so far in advance of their appointment, it ends up becoming their whole day. But
I saw a few questions over here. We had one here. We had one here. I think we'll have time for one more. John Trowell. All right. So Ariel.
Hi, I'm Ariel. Thank you both. I'm with the Senate Committee on Aging this summer. I'm
my alma mater.
I'm wondering regarding the price negotiation, does that only affect Medicare Part D prices, or will that affect that for all consumers?
It will affect Medicare Part D and Part B prices.
But not for...
It will not affect commercial prices directly.
Okay. And is there any kind of evidence in that, in the fact that innovation will be hampered in any way, which many pharma companies are kind of claiming at this moment?
No, there's no evidence. I mean, this is what they're saying, but I think, they say it, but there's obviously a lot that's still going on. But there are people like Mark McClellan and others who are saying pretty forcefully and that this will have a dampening effect on R&D. I don't think we've seen the evidence that that's true yet, and I think in part it will depend on how aggressive the price negotiation process is. Mm-hmm. But it's a little bit of a he said, she said right now.
Okay, and then on a other topic, my question was regarding LTSS, and if there's ever a prospect of LTSS becoming a part of the Medicare benefit to not require individuals to spend down their assets and become eligible. Is there ever a political pathway for that to happen?
I mean, there's certainly such a high, you're saying Medicare? There's certainly, what we haven't really talked about is this is a population that will be aging and increasingly frail and need services. So the number of people who will need long-term services and support is just growing. And I think there will be more interest in expanding Medicare, and because this is not just an issue for people who spend down or are already very low income. This is a middle income problem, and people cannot afford the cost of having full or even part-time paid care at home with the resources that they have. I know there are discussions going on about whether or not to expand Medicare in any way to provide home and community-based services, but based on your experience in the Senate, you might know that there's a lot more interest in vision, hearing, and dental than home and community-based services. And so I think that's sort of a matter of member priorities and the push of the advocacy community.
And Natalie, I don't know if you want to weigh in on that at all, given that there are other pathways that get talked about for LTSS, HCBS.
Yeah, I mean, the primary focus and for Senator Casey too is shoring up Medicaid, because the structure, the general idea of the program and the scope of services that Medicaid can cover is really great, So it's not that we don't have anything that works, but it's just not well funded and resourced, and then we have a workforce crisis. So just saying okay, Medicare is going to cover this now wouldn't help that issue.
I know Chantel was making a hard push for you all to become ERISA lawyers, but I will say if there is an area that we need a lot of energy, it is the long-term care conversation. And folks may be incredibly and increasingly aware of that through your own lives and your own families. I know I'm feeling it in my family right now. I feel like the more people I talk to who are younger and younger on these issues, people realize that this is something we have to deal with. This is a massive gap in our social insurance fabric. So just a plug for anyone who's thinking about where they might want to spend their energy in one of the next frontiers that needs to be tackled. We had a question right here.
Hi, I'm Madeline McBride. I'm with Georgetown Center for Children and Families this summer. And back to drug pricing negotiation. Sorry. Do you feel like there's a risk that with the Chevron ruling, because so much of the negotiation process has been determined by CMS, that the pharma challenges in courts are going to be potentially more successful, that this whole thing could be overturned?
Yes, I mean, I have concerns about that. I mean, I think we've yet to see what Chevron can do to, I'll just speak to Medicare, because CMS really makes a lot of decisions. And, you know, for those of you who work on anybody else work on the Hill this summer? No, I mean, people do, you know, people who work on the Hill, I worked at the Ways and Means Committee for 6 years. And people develop expertise, but you cannot possibly anticipate every decision that will need to be made to implement a law. It's virtually impossible. And so it kind of makes sense to delegate authority to people who have the ability to not only, you know, propose, they propose rules, and then the public comments, and then they revise. And there's almost every aspect of Medicare could be subject to court review due to Chevron. So this is just one more example of that. And it will require a whole different way of legislating in order to keep the program working as it is supposed to work.
It's a great question, and I'm getting pitched to do an event that the Academy is going to host on Chevron and what it means for social insurance. So
great idea.
We had I think, John Trell, you had a question.
John Trell Bowles with Medicaid and CHIP Payment Access Commission, also known as MACPAC. I'm interested in speaking more to LTSS. Can you speak to some of the eligibility and policy barriers that are prohibiting timely access to those services, and sort of why we see, you know, different processes such as 1115 waivers, presumptive eligibility, and expedited waivers, you know, sort of varying across states? Is there a way we can sort of get some sort of consistency within the states?
So yeah, so within a state, they often have multiple programs that serve different populations for home and community-based services. That might be a waiver specifically for older adults, one specifically for people with intellectual and developmental disabilities. So ideally, what we want is to pass the HCBS Access Act, which would make Medicaid home and community-based services a mandatory benefit, just as nursing facility services are. That would totally shift that dynamic. We wouldn't have all of these different programs within a state. It would, you know, get rid of the waiting list issues and things like that. But we also have lots of work to do prior to that to chip away at the institutional bias. One thing is that you can go, if you need long-term services and support, you can go to a nursing home tomorrow and be admitted, and the nursing home will help figure out how Medicaid is going to pay for that, because they know they're going to get paid eventually. It's not the same for HCBS. You have to wait for your Medicaid application to be finished. So yeah, getting quicker access, you know, helping people get a basic service plan in place right away so that they don't have to wait would help a lot.
So you guys have a question from one of our speakers today, who is not going to pretend to be an intern because I've outed him.
Yeah.
Translator information.
And we saw him speaking.
Yeah. Real quick question. Dual eligibles for Medicare Part D, right? So maybe I'm going to answer this out loud. So Medicaid, right, covers prescription drugs voluntarily across the country. But then once they're dual eligible in Medicare covers the drugs. Now, before Medicare Part D, the dual eligibles, they got Medicaid prescription drug coverage, which is better than Medicare Part D. Anyway, the Medicare Part D dual eligible program is, I don't know if you want to make any comments on it. I ran a program and I just found that the private insurers do the low cost because I think by law, all the dual eligibles have to go into the lowest cost plans. So you've got this weird market force where United Healthcare and Humana are always constantly lowballing to get that get those people in there, which throws off the whole market and puts little plans like mine out of business. But anyway, I got that right on the Medicare Part D.
Pretty much.
Yeah.
Pretty much. And so there was something called the clawback when prescription drugs shifted for dual eligibles from Medicaid to Medicare, and Medicare was picking up the cost, there was a clawback from states so that states would, remember that? Like they would get this, instead of just getting huge savings, they would have to help contribute. So when people go onto Medicare and they are dually eligible for Medicare and Medicaid, they qualify for low-income subsidies, which almost fully covers their premium, and it covers most of their prescription drug costs. If they are in what is called a benchmark plan, and there are fewer and fewer of them actually. So I don't know when you were doing this, but there used to be a bunch of them out there, and each year there seem to be fewer benchmark plans available, which means that lower income people have fewer choices of Part D plans that would give them their full subsidy than other people on Medicare.
No, this is great. So please join me in thanking our final speakers today, Natalie and Tricia. And Tricia, thank you again for this wonderful space.
Oh, thank you all for coming, and thank you for hanging in there to the last panel.
I know. These are the late stayers.
That's tough.
So I'm going to come sit with you guys for just 1 minute while I make a few closing announcements. Actually, I'll stand up. Just want to say first off, it has been so much fun getting to hang out with you guys today. This is such an amazing group, and honestly, it's spaces like this and it's groups like this that give me a lot of hope for the future. And that sounds like such a hokey wonky thing to say, but I really mean it, because walking around eavesdropping on some of the small talk on, the table discussions for the Social Security Solvency plan, we need y'all running the country, right? So thank you for spending the day with the Academy, but also for your passion and your energy around wanting to not just protect, but strengthen social insurance. So it's been fun getting to hang out with you.